Good evening. I am Dr. Jaime Rodriguez, Vice President of the Weslaco ISD Board of Trustees. This board workshop is being conducted pursuant to the Open Meetings Act. Notice of this meeting has been posted online for at least 72 hours. The board is meeting by the use of Google Meets and telephone transmission, which allows two-way communication for members of the public during public comments. A recording of this meeting is being made and will be available to the public at a later date. The time is now 5:24 p.m. and I call this meeting to order. I will now begin the roll call. Mr. Isidro Nieto?
Present.
Mrs. Jackie Sustaita? Coach Jesse Trevino?
Present.
Mark De Los Santos?
Present.
And myself. A quorum is not required for board workshops. And we will move on to item 3, public comments.
We have two.
And first one on the list, I have Angie Pedraza. And then it's Janie Pasadu. Are y'all going to be presenting together? Yeah.
Okay, yeah.
So just a few comments before you start. Just some formalities here, okay? What I'm going to do is have both of y'all state your since y'all are on the list. I'm going to have you both of y'all state your name and address,
Okay,
and then I'll read some comments, and then we'll give you some time, okay?
okay.
So let's go ahead and start.
Okay. My name is Angie Pedraza. Address is 1809 South Texas Boulevard, here in Weslaco, Texas.
Okay.
Hi, I'm Janie Basaldua. My address is 14396 Palace Drive, La Feria.
Thank you. And so let me just say a few words here. Pursuant to the Texas Open Meeting Act, the Board of Trustees may not deliberate on any comment made by a member of the public on a subject that is not included on the agenda posted with notice of this meeting. As per the Texas Attorney General, the scope of board discussion for a subject not part of the meeting agenda is limited only to a proposal by a board member to place the subject on future board agenda. Specific factual information or a recitation of existing policy may be furnished in response to inquiries, but the board shall not deliberate or decide regarding any subject that is not included on the agenda posted with notice of the meeting. Audience participation at a board meeting is limited to the portion of the meeting designated for that purpose. At all other times during a board meeting, the audience shall not enter into discussion or debate on the matters being considered by the board unless recognized by the presiding officer. No public comment presentation shall exceed 5 minutes. Any disruptive behavior by any speaker may result in the speaker's removal from participation in the meeting. Please be mindful of using names or personally identifiable information, as there is no immunity from defamatory comments while participating in public comments. Okay? And we're going to get you 5 minutes, so you guys may begin. We keep the time. See. Go ahead.
Okay, Dr. Valdez, board members, thank you for this chance to speak up on this telemedicine topic. So I just want to make some few brief points before the board decides to commit to something like telemedicine. And so for telemedicine, the main goals, I would like for you all to look at the main goals for telemedicine. Number 1, it's to make primary care health available in rural communities. There's a lot of communities that they don't have. Weslaco, thank God, we're blessed. There's an overflow of providers in the area. Also, the second main goal of telemedicine is to minimize the risk of exposure, from person to person exposure. And so having telemedicine on the school campus, it is putting the Weslaco nurses at increased risk for transmission and exposure to viral and bacterial infections. So those are the 2 main goals. And so the main points for consideration is the necessity for telemedicine, the practicality, the risks and the safety, and then I'd also like to kind of comment on the legal aspects, because I'm not too, I know y'all have the lawyers and stuff, but if they could look into some legal concerns that I have and policy concerns. So as far as necessity of the telemedicine program, as of September 17th, personally, at Silva Elementary, I've seen 201 students that I've sent home sick. From those 201, 199 have come back with doctor's excuses to return to campus, or they've been cleared, or other than that, they've also come back with COVID negative tests. And these tests, they get them at free community COVID testing centers like the Curative Vans. Ashley's Pediatrics also does free COVID testing. And so the parent doesn't have to pay for a consult. They just go in and they do the COVID testing. So that's a really big help in the community. As far as practicality, really, it sounds great. Telemedicine is an awesome platform. But in the school setting, at the nurse's office, it would not be, it's not effective. I have down here that in August, I saw 395 kids that that came into the nurse's office. In September, I've seen over 600 kids that I've logged and documented that have come into the nurse's office. So we are full. Kids are coming in and out of our offices. We're sending them home. We're checking to see if they're here, if they've got clearance. So we are very, with all this COVID, we're very, very busy, as all of us are. But that would be something to consider. It would not be practical. It would really set us back. Because as others, I think, will come and say, a telemedicine visit does take up a lot of time. And right now, there's only 2 nurses at Silva, so if one of us was with the sick child, that would take up a lot of time. So the third point is risks and safety. Having the nurses collect nasal swabs or throat swabs from a sick child in the nurse's office, that's putting us at risk for us catching something. Also, we have to remember that it's not safe to service both well students and sick students. In the doctor's offices, even right now with this COVID, they do separate them. I've done clinical rotations at doctor's office. They see the follow-ups in one section of the office, and then they have all the people who are sick, like with fever, sore throats, anything that could be considered COVID, they have them separate, and they check them for, they test them at separate locations. So having to do that in the nurse's office, it's not practical. Also, on the legality and the policy, one thing that concerns me is who will be accountable and responsible for the bad outcomes. I don't want to put my license in jeopardy. I wouldn't, hope that, because we never know. We try and do good, and then something always, happens. So that's something to look at. On the board policies right now, there's a health and wellness policy that says that the district may contract with a person to provide services, but it says that it should be at a school-based clinic. Man, we don't have a school-based health clinic right now. All we have are the nurses' offices. Also, another concern of mine is the stocking and dispensing of medications. That's a pharmacy scope of practice to stock and dispense. As nurses, I am able to administer medicine that a doctor orders, but right now the district policy is that the parents bring that in. It's not something that I'm stocking in my office and I give. It's something that the parent brings to me that has been prescribed, and so I keep it in there, but it's not stocking. And this program wants us to keep a stock of medicine so that we can give, and of course they'll also prescribe if it's prescription medicine, but my concern is the stocking of medication at the nurses' offices. So in conclusion, I just think the school nurse's office should not be treated as a clinic or converted into a clinical setting. The telemedicine on campus contradicts the current health and safety protocol, which is sick individuals should stay home and contact their physician. The school nurse's role is to promote health and wellness and to prevent the spread of disease. And so I think our time is most productive by enforcing the current health and safety protocol, which, if you all have seen, I'm sure you all have, the COVID board at Silva, we have 473 students enrolled, and I only have 2 active cases because I am doing my best to keep the school safe, making sure they go to the doctor, making sure they come back with clearance. So what we have right now is working. I don't feel the need for telemedicine into the nurse's office. And for the district, we have over 15,000 enrolled, and there's only 56 active cases. So WISD policy and protocol is working right now, and I think we should stick with that and not bring in telemedicine. Thank you.
Thank you.
Well, she kind of touched all my subjects. Hi, Dr. Valdez and the board, thank you for having us. The only thing I can say is I spoke to a few nurse practitioners from the local area, and they don't recommend us assessing minors without their parents present. I know at one of the June board meetings, it was suggested, this would be something for the parents so they don't have to leave work. I wouldn't recommend that. I don't think any of you would drop off your kids at the doctor's office and then go. That's the way I see it. A parent needs to be present with minors, and right now, I don't think this would work for us. Like she said, we are very busy, just with contact tracing and all the backup and all the different forms that everybody has. So, and also, I want to touch up on the legal basis. I know Tracy mentioned last week that we fell under their umbrella, but you can come and sue me personally for something I didn't do or I did for your child without them being present. Without the parents there, they can say you did a swab without me being there. They do that just now, when you don't call them or you don't reach them. I can't imagine them coming back and trying to accuse me that I had their child swab without them being present. So I think at this time, especially with all the COVID information that we have to do, it's not logical. And like I said, she already touched most of the bases, so thank you for your time.
Thank you. Thank you for your comments. I'll let the record reflect that Andrew Gonzalez, a right of 533. And now we'll move on to item 4, presentation by telemedicine service providers. Dr. Valdez.
Mr. Vice President, Dr. Rodriguez, I'm going to call on staff, Mr. Mike De La Rosa. He will introduce I believe, one provider who will be presenting this afternoon.
Yes, good afternoon, Dr. Rodriguez, Dr. Valdez, members of the board. As you know, there was an RFQ released for telemedicine or telehealth services. We had one respondent respond to the RFQ, and as per direction from Dr. Valdez, we did present the one company, Goodside Health, did meet with the nurses earlier last week, and at the request of Dr. Valdez, we are conducting this workshop so they present to the board as well. So with that, I will turn it over to Ms. Tracy Spinner. She's with Goodside Health. And Ms. Spinner, I know that I told you that you would have 10 minutes to present. I was just informed by our Assistant Superintendent for Business and Finance that normally we limit these to 5 minutes. However, I did tell you 10, so I ask that you please keep it under 10, and then that way to give the board to ask questions and respond. So I'll turn it over to Ms. Spinner.
Absolutely. Thank you so much. Good evening, Dr. Valdez, members of the board. My name is Tracy Spinner. I am the Executive Director of Goodside Health, and with the help of Mr. Martinez, this evening, he's going to run the presentation for me. So Mr. Martinez, if you don't mind pulling up the presentation and sharing it. Perfect. Thank you very much. So next slide, please. So when we talk about how we present and how we partner with school districts, we do that because our mission is to close gaps in healthcare for children and to provide that equitable and convenient access for all students. Not only are we helping to support your students' physical health, but also their mental health. So we can also provide mental health services and treat common health conditions that are seen in health rooms. Next slide, please. In 2018, we started partnering with our first district, that was in El Paso ISD. Our platform and our workflow is built by school nurses. So we partner with school nurses across Texas. I'm a former director of health from a large urban district in Texas, where I served 17 years as a director, helping to lead and grow comprehensive health programs and public education. We're a whole child company that we often provide multi-tiered systems of support that is accessible, again, to all students. Parent consent is required. So this is an optional program. So parents can opt in to our services and we would work with your school district to provide the consent form, whether it's in digital form, electronic form, or a paper form, or we can provide both, to give parents that option who would like to consent for the services. Again, we will work with you to integrate into your district systems. And also, our services, as we presented in our bid, is at no cost to your district. Next slide, please. So currently, we're serving more than 720,000 students across Texas with 64 school districts. Next slide. Our current partners in your area are PSJA, Mission, Hidalgo, Rio Grande City, San Benito, La Jolla, San Carlita, Lyford, and Donna ISD. If you'll play the video, that will give a good overview of our program. Mr. Martinez, thank you.
Goodside Health is revolutionizing healthcare by making it possible for students and staff to be seen by a doctor at school. We can evaluate, diagnose, and treat students and staff in the nurse's office. We're here to enhance school health with you as our partner. During a student visit, the school nurse will speak with one of our board-certified doctors or providers through an online video call through an iPad we provide, and this collaboration enables us to treat students. With the direct contact and support of our school med team, and after receiving our in-person and virtual training, the school nurses are empowered to measure temperature, collect nasal or throat swabs, and run diagnostic tests for strep, the flu, and COVID-19 where deemed necessary. With that information, our medical team can then diagnose, treat, and send prescriptions electronically to the student's local pharmacy. This enables students to get treatment at school, prevents parents from having to leave work, helps prevent the spread of illness, and keeps more healthy kids in class. We provide all medical supplies, training, and technology needed at no cost to you. Our highly skilled medical staff are board certified in pediatric care with experience in primary care, urgent care, and behavioral health care. We take a whole child approach and can treat fever, cough, rash, stomach illness, and much more online. We also provide on-site sports physicals and offer age-appropriate mental health screening and services. Parents and guardians can even be included in the telehealth visit without having to leave work. We treat patients with and without insurance and have translation services available to help serve as many people as possible. Our medical program integrates seamlessly with your student information system, and students can sign up for Goodside Health during their school registration process. Contact Goodside Health today to sign up for the program and be a hero to your students and district. Let's keep your students healthy, safe, and learning together.
Thank you, Mr. Martinez. Next slide. So when we talk about what this looks like, so services are provided on campus. We will customize your implementation and your rollout. We would work with your Director of Health with Susan and with Mr. De La Rosa to identify. We would start with campuses based on their discretion. So if we want to start with a small number of campuses, and we can roll out more campuses as we bring additional on, or we can start with all campuses. That is completely up to your district. All of this is customizable to fit the needs of your student health services team. Again, we want to empower your school nurses. Nurses are valuable and they are very busy. Our program, was developed by school nurses that understand what the school nurse room looks like. And when we do that, we provide this on-demand access to that quality, culturally competent care, regardless of a student's socioeconomic or immigration status. Next slide, please. There are two particular laws that when you partner with a telehealth provider, when you partner with us, we're helping your district meet two of your statutory requirements. One of those is your Senate Bill 11, Safe Supportive Schools program that requires your district to have a multi-tiered system of support. Again, we're helping to provide that with our mental health screenings and helping to assess for student behavior. Also, your Senate Bill 19, your coordinated school health requirement that requires your district to provide a comprehensive approach to child's health. Next slide, please. Some of the benefits to our district partners, it eliminates barriers. So for many families, they may have a primary care provider, and that is amazing. We help to connect with that primary care provider. So as an example, if a child is seen through a telehealth visit, at the end of that visit is a discharge summary and also a school note. So that discharge summary on the consent process, if that parent gives us their primary care information, that discharge summary can be sent to their primary care provider, informing that provider that they were seen by one of our telehealth providers and to follow up with their patient. And, a 7 to 10 days is typically an example for a commonly diagnosed condition. In addition to that, this helps to eliminate any transportation barriers and time off of work for conditions, as an example, that are non-communicable, where children don't have to go home. I know I have a 14-year-old daughter, and I know sometimes she may go to the nurse's office for a headache. And right now, what we want to do is we want to keep healthy children in class and not have them coming back to that health room over and over again, not feeling well, because that, again, compromises them being exposed to a communicable illness that is in the health room. And so if we're able to treat students that may have a headache, we can provide them with that over-the-counter pain reliever and get them back to class feeling better. They're less likely to come back to the health room over and over not feeling well. Parents can also join the telehealth visit. So the school nurse has the option to let the parent join into the visit, where the parent, the provider, and the school nurse can be in a visit together, just like we're on a Google Meet together today. In addition, we offer district-wide programs, including social emotional learning, mental health screenings, and teletherapy access. We're increasing attendance and in-class seat time. We can treat those commonly diagnosed conditions in school health. And then we're also investing in your community. We have a local provider who lives in the Rio Grande Valley. We also have 2 engagement coordinators who also live in the Rio Grande Valley, who are partners with your district and would go campus by campus, meeting with your amazing school nurses and helping to support them every step of the way. Telehealth is available at home and at school. So we too want to keep healthy kids in school and sick kids at home. So if you've got a kiddo who wakes up in the morning and they're not feeling well, and let's just say the parent tried to get a sick visit at their pediatrician's office, but all the sick visits are taken for the day, they can click on our urgent care kids link. Thank you so much. They can click on our link and they can be connected with one of our providers before they send their sick kiddo to school. Next slide, please. Some of the benefits to school nurses, we went over these the other day when I met with your great school nurses. So we can skip this slide, go ahead to the next one. Let's skip this slide as well. This is one of our nurses talking about how it's a game changer for this program. And some of our additional data that is in the presentation, which you have and can refer to, one of those things is, again, we're providing those medical orders for your school nurses to protect them. It's our physicians that are diagnosing, assessing, and treating and providing your school nurses with the resources that they need to help, again, treat sick kids, get them sent home, identify what their conditions are sooner, and then keep healthy kids in school. At this time, I will pause and I will take any questions from the board.
Thank you, Mrs. Spinner. Now we'll open it up for some questions. Coach Nieto?
I think it's a good program, but like the nurses mentioned, maybe not at this time, but if we can further look into it and maybe implement it later on. I know she mentioned about the students and the parent meeting via, I guess, telephonic. But most parents, and I as a parent, normally like to take my son or daughter to my pediatrician. That's it.
Just want to note the record that Jackie Sustaita joined at 5:38. Jackie, are you there with us? At least I had seen her sign off.
She was on there.
Coach Trevino?
I have I have 5 kids, so we had to miss a lot of work, to take our kids to the doctors and so forth. So I can see this working out. I heard the nurses expressed, our local nurses here expressed some concern. But I see you guys have 54 districts involved with this program. So, Ms. Spinner, what can you provide in addition to help reduce that concern that our nurses have? What else can you guys provide to make sure that we are doing something, because obviously it's successful. I notice a lot of schools here in your program, so if you can please provide us with additional information there, just how you can help us directly.
Absolutely. Thank you so much. And so I heard your, school nurses express some concern around, legality and policy and its effectiveness of in-school telehealth. And what I can share. And again, this is from my personal experience, not only as a parent, but also with our over 1,000, school nurses that we have partnerships with now. School nurses value the access to on-demand healthcare providers, that in the moment that it can help them be able to triage students who may come in. As an example, right now, if you have a child that comes in the health room with a runny nose, a fever, and a cough, you're not sure what that is, right? And so most likely your COVID protocols say if this child has COVID-like symptoms, which right now, COVID-like symptoms can also be allergies, it can be a common cold, it can be a whole host of things. And with our providers, we're helping to early identify and to rule out what that might be. So as an example, the child comes in with a runny nose, a fever, a sore throat. We too want to make sure that that child is at home as quickly as possible. And the example that I gave when I met with the school nurses last week was, yes, we want to get sick kids home, but we also want to early identify what that is. And so if we're able to meet with that provider and that provider can say, this is probably a common cold, this is not consistent with COVID, that child can go home for 24, 48 hours and then come back to school if they can conduct that rapid test there on campus. Again, the rapid testing, whether it's COVID, flu, or strep, is a very fast, efficient way to early identify and to rule out what some of these symptoms might be. A strep test is a 5-minute test. A COVID or a flu test is a 10-minute test. And you can give that parent and that building principal and Dr. Valdez, the superintendent, some peace of mind that some of the children that you saw that day, they don't have COVID, that it's actually the flu, or it's a cold, or they have allergies. Now, related to legality and to policy, I'm very familiar with the school-based health clinic laws in Texas. And telehealth, in 2018, the law changed in Texas that does allow for telehealth to be provided on a campus. It doesn't have to be strictly at a school-based health clinic. Now, in terms of legal, so when a parent consents for our services, they're consenting to treat. They're consenting for our providers to assess their child. Again, they can join the visit, and this is optional. This is not a required program. So I think, Mr. Nieto, you said that this is something that you may not use as a parent, and that is your absolute right as a parent. And then, sir, you said that you have 5 children, and this is something that you felt would be of value to you, and you could opt into the program. So this is an optional program for parents who may see this as valuable to them. And again, we would work with your district and with your school nurses and with Susan to early identify those early adopters and those early campuses. And we've done that across many of our partners. So we start small, and then we can grow the program, across the district as we adopt, into our telehealth program.
Dr. Rodriguez, I'm sorry, my microphone cut off, but I was here.
Okay, Jackie, you have any questions?
Yes, actually, I do. Thank you. Ms. Spinner, hi. Good afternoon. I was researching through scholarly articles actually about telehealth and the benefits that it has, and I was reading that there's actually student achievement outcomes improve with schools that have telehealth and telemed services. Their attendance is also highly improved with telehealth and telemed services. Grade point averages go up with telehealth and telemed services. So all these are great benefits that the students, not only health-wise, but academically also, we see great improvement in the schools who are utilizing this service. And I know that, some people say, well, right now isn't the time. And for me, as a parent with 5 kids in high school and middle school and elementary, this is the perfect time. Because right now is when I want to know if my kids am I dealing with COVID? Am I dealing with a flu? What exactly am I dealing with? And for the school to be able to tell me that before or when I go pick them up, or I don't have health insurance for my children, so I have to pay out of my pocket to wherever I have to take them. So for parents like me, this is a great benefit. I know there's a lot of people in the district, in our community, that face the same problems I do. So this to me is a great benefit, and I just would like to know more of what would be the workload for the nurses that they're saying that this isn't right at the moment. That's what worries me, even though I see the benefits.
Trustee Sustecta, thank you so much for bringing up the benefits. So right now, across all of our district partners, we have a 65% return to class rate. So when healthy students are identified that may have conditions that don't require them to go home, we can actually treat them in the health room and then get them back to class. Now, that typical time in the health room is about the same time as they're going to spend in the health room now. Your nurses are always going to triage students. They're always going to follow their same workflow. So when they request a visit with one of our healthcare providers, that provider is picking up that visit request in under a minute. So when you're on the screen with that provider, the provider is going to do that very quick assessment of the child to determine if this is communicable, if this is not, if they can go back to class, what they need to do to get the kiddo feeling better. And also, if a child, as an example, if they come into the health room in the morning at 8:30 and they just got to school, they're not feeling well, they got into the health room, and the nurse can request a visit with one of our providers, and let's just say the kiddo needs to go home. That discharge summary is a school note as the last one. That note can go to the PEMS clerk on the campus, and even if the child goes home before 10 a.m., which is typically when you do your attendance snapshot for the day, that child can be counted present with that telehealth note. So the compulsory attendance laws changed also a couple of years ago to allow for a telehealth visit done on campus, that child can be counted present toward your daily ADA, okay? So in addition to that workload, it's not, if the nurse has to do that rapid test, whether it's rapid strep or flu or COVID, they don't have to sit there on the iPad for 10 minutes, right? They can pause the iPad, collect the nasal swab, which takes seconds, put it on the card to get it run. That takes seconds to put 6 drops on the card. They can see other children that are coming into their health room while that test is processing. They don't have to sit there and wait for 10 minutes. After the test is done running, they just unpause the visit on the iPad, tell the provider it's positive or negative, and the provider is going to finish out the visit. The nurse doesn't have to do anything after that. That discharge summary is going to come to the school nurse. It's also going to go to the parent to let the parent know that they were seen in the health room that day if they didn't get to join the visit. So it's not as much time as you're assuming that it might be. And in addition, when you call a parent, let's just say the nurse, as they're always going to do, if there's a sick kiddo in the health room, you're going to call the parent to say, Jackie's in the health room. She's not feeling well. I see that you have consent to telehealth. I can start the visit while you're on your way to come pick her up from school, right? So in that time that it takes the parent to leave work or leave home to come pick up the child, they can conduct a telehealth visit so that when the parent gets to school, they've been assessed, they've been diagnosed. If they have a condition that requires a prescription, it's already been called in by our providers to the pharmacy that the parent wants. And the parent goes to the pharmacy, picks up the prescription, picks up the child from school. The child can return to school sooner. For cases like strep throat, as an example, typically children are out of school for 4 days if they have strep throat, from the time that they can see their provider, get their medication, and then recover. With telehealth, they're typically out of school for 2 days. And so we're reducing that time, that out of class time, by being able to early identify these commonly treated conditions.
Thank you, ma'am. Mr. De Los Santos?
Yes. I think my question is probably going to fall on Mr. De La Rosa. I think I'm going to ask for some numbers as far as with the telemed, the telehealth. When we were looking at this, when this first came back, this was back in December when this first topic came up, and I know that there was difficulty in contact tracing. I know that we had different protocols in place, and we were sending whole classrooms home, and that was causing a massive burden on parents, our staff, principals, attendants, instruction. So where are we at now as far as, like, I know we had some of our district nurses bring up some numbers from some of the campuses. What does it look like now as far as on the campuses, as far as what protocols are we sending everyone home still? Are we doing the contact tracing? I know that was something that was going to expire soon, or was going to be done at a minimal. I mean, is there still difficulty in all that? Because that was a major question back in December when this was brought up, is how fast can we identify a student that has symptoms, whether they're positive with COVID or not? And at the same time, while doing that and identifying whether it's COVID or not, we can also actually pre-screen the child, so when the parent does pick them up, we can identify that they're negative. Because when a parent leaves work, picks up the child, then they have to take that child somewhere in some cases, because they have to go back to work. So that way, it was just kind of looking at the safety of everyone involved, the campus, the staff as well too, that made contact with the student, the classroom, the students in the classroom, and all those families. And then the families of where those kids will be going, because with me, if I have to pick up my child, I have to take them somewhere. And I don't want to compromise that household as well. So that's kind of was the theory when we're looking at this. But now that we're here, fast forward to September, what is the current status on campus? What does that look like?
So the protocols for contact tracing, notifying families, the nurses have them, the campus COVID response team have them. There are posted online also in our continuity of instruction plan that is posted online. So I do see numbers, but as far as day-to-day actual, the COVID-19 campus team on campus along with the nursing staff, they actually do the contact tracing for the students. So if a student comes into the nurse's office, the student has symptoms. This just happened to me yesterday with my own daughter. So I got the call. She has symptoms, et cetera, et cetera. So I had to go pick her up, take her, get her tested, and then get the clearance, come back to school. So if she would have been positive, then the nurses would have gone back and had to conduct the contact tracing to see who was within that, 3 feet, where they all wearing masks, where they're not wearing masks. And I think that they're the frontline operational status, so they can be more of a valuable resource than me to tell you as far as how it works operationally. I mean, we write the plan along with the nurses, but I don't go and do the contact tracing. Right. The staff does it. Okay. We assist with the employees, but as far as the students on campus, that's done by the nurses, really. So I would okay. recommend that you get their feedback on that.
Right. Because back in December, yes, you can step forward, man. Because I know back in December, one of the meetings that we had, there was somewhat of a delay when a child would get sent home with the parent. Then the administration or the campus itself had to kind of struggle sometimes making contact, getting a confirmation were they negative or not, because sometimes there wasn't feedback. Is that still a problem, or is that?
I will say that back in December, this was all still very new to us, right. And so we've come a long way as far as developing our processes and procedures. So I don't think we have that problem anymore, but I'll let Ms. Kaufman.
No, we've significantly, with the new regulations of 3 feet or more in masking, right. and with our HEPA filters, and with the desk shields, we've layered our mitigation strategies. So it's decreased the number of kids we've had to quarantine. The problem is we have more kids on campus, so we have a lot more kids with symptoms. Curative has been very helpful with the PCR for the kids who are quarantined and want to come back early on the 5th day. It was a little rocky in the beginning, trying to explain to parents what we've done, but the parents are getting used to it. We've fielded many phone calls from parents, and I think they understand the process more. Things are just much better this year, and I mean, we have more. I think, if I had to guess, we've maybe quarantined 250 kids since the beginning. And we haven't had we've had very few positives, so.
Thank you.
Thank you, ma'am. Mr. Gonzalez? Any
Yes.
questions?
Ms. Brenner, quick question. Going back to your example of strep, how is it different that it's 2 days with y'all and 4 days here locally?
So the difference is when you're able to conduct that rapid 5-minute strep test within a 10-minute visit with our provider, you're reducing that time delay. I'll give you an example. So my daughter, I had to pick her up from school today for a sick visit. And I called the pediatrician's office to make an appointment for this afternoon. And the next time they have a sick visit appointment is not until Thursday. So my daughter is now going to miss all day school tomorrow without having that sick visit. And so with telehealth, you're able to conduct that sick visit in real time. The provider is able to assess the child, give the school nurse that medical order to conduct that strep test, because again, school nurses can't assess, diagnose, or treat. You must have a medical order from a licensed provider to be able to conduct that testing. So, sir, it helps to increase that access to care more timely, and that you're able to provide these services right there in the health room versus having to wait a day or two to get that sick visit in. Again, it's completely optional. If a parent wants to just come pick up their child, make that sick visit for 24 or 48 hours later, it is completely up to them and them as a parent. But this as an option helps to reduce that barrier to care, where you can conduct that rapid test on campus, get that diagnosis right away within 5 minutes, and then that prescription is called in same day to the child's pharmacy. And as long as they're fever-free, within, returning to school 24 hours without fever, they can return to school sooner versus a delay in diagnosing, which is a delay in their ability to return to school.
Gotcha. Thank you. Hold on, not done yet. So, and thank you for that clarification. Now, our nurses already treat stomach aches, coughs, headaches, allergies. They do a phenomenal job. We're a small community that has a bunch of PCPs, as we're the only one that has a hospital here in the Mid-Valley. What does that do to our current providers here locally? Since you're going to have to send them the information, how is that not taken away from them?
Yeah, that's a great question. So because we are what we consider a stopgap for services, we are not their PCP. We cannot conduct preventative care visits through telehealth. So things like immunizations, well child exams, case management of chronic conditions. Telehealth is really designed to be that acute illness provider that we can help treat those things in real time and then connect them with their PCP, with their provider for that ongoing care. Again, strep is a great example. We can diagnose strep via telehealth very effectively and efficiently, and then connect them with their PCP if they're not doing better in 7 to 10 days, for that PCP to follow up with them to conduct that additional assessment and evaluation. Also, we're an optional program, and we work with many providers across the state of Texas, where we are part of that continuity of care, and we're not replacing their PCP.
Thank you.
Thank you, Mrs. Spinner.
You're welcome. Thank you very much.
Appreciate the time you took to present this to us and educating us on this program. Thank you.
Absolutely. And you do have my PowerPoint presentation. I did provide that to Mr. Martinez. So if you would like to share that information, there's some additional data additional information about return to class rates. There's a couple case studies with 2 school districts in Texas that I shared. Feel free to additional look at that information.
Will do. Thank you.
Thank you so much.
So I'll move on to item 5, adjournment. And it is 6:08. Do we want to? All right. Board of Trustees. This regular board meeting is being conducted pursuant to the Open Meetings Act. Notice of this meeting has been posted online for at least 72 hours. The board is meeting by the use of Google Meets and telephone transmission, which allows two-way communication for members of the public during public comments. A recording of this meeting is being made and will be available to the public at a later date. The time is now 6:10 p.m. and I call this meeting to order. I will now begin the roll call by calling each board member's name. Please acknowledge your presence. Coach Isidro Nieto.
Present.
Mrs. Jackie Sustaita.
Present.
Coach Jesse Trevino.
Present.
Mark De Los Santos.
Present.
And Andrew Gonzalez.
Present.
Let the record show that a quorum of board members are in attendance. And I will move on to item 3, opening prayer. Dr. Valdez.
The invocation this evening will be delivered by Elva Ray, our WHS social worker.
Good evening, members of the board, Dr. Valdez, administrators, and all that are joining us virtually this evening. Let us please bow our heads. Gracious God, you are indeed the giver of all good gifts, and we thank you today for all of your blessings. We thank you for the students we serve, for all of our staff members, both teachers and all support staff. We ask for God's protection from this virus and that we all be spared the worst of this illness. Protect our staff and students in and out of the classroom, as well as their families. Heavenly Father, we come to you today asking for your guidance, wisdom, and support as this meeting begins. Help our board members engage in meaningful discussion. Allow them to grow closer as a group and to nurture the bonds of the community they have been elected to serve. We ask that you bless them abundantly and that they continue to seek your wisdom, guidance, courage, and strength. Help them to be wise in the decisions they make for the good of all those who have placed their trust and confidence in their leadership. Grant them the humility to always seek your will in all they say and do. All glory be to you. In your precious name we pray. Amen.
Amen. Thank you, Mrs. Ray. We'll move on to item 4, Pledge of Allegiance, Texas Pledge. Dr. Valdez.
All right, good evening.
Good evening.
Dr. Valdez, Dr. Rodriguez, members of the board. I do have 3 members of the Weslaco Panther Corps. They will be leading us in the pledge, but first let me say a few words about them. First of all, I'd like to start off by introducing Eliza Gonzalez. She is a junior at Weslaco High School. She is the daughter of Eli and Eva Gonzalez. Eliza is the head drum major for the Weslaco Panther Corps and plays the clarinet. She received a Division I rating for solo and ensemble and is a member of the honors band. Eliza is also part of the National Honor Society, Health Occupation Students of America, and she plans to attend the University of Texas at Austin to major in nursing. How about a big hand for Eliza Gonzalez? Also, I'd like to introduce Marina Garcia. She is a senior at Weslaco High School and is the daughter of Edward and Lisa Garcia. She is an assistant drum major of the Panther Corps and plays the bass clarinet. Marina is also in the honors band and has received a Division I rating in solo and ensemble for 3 years. She is a member of the National Honor Society and plans to attend the University of Texas at San Antonio to study criminology. How to big hand for Marina Garcia. I would also like to introduce Damien Casas. He is also a senior at Weslaco High School and is the son of Damien and Veronica Garate. He is assistant drum major for the Panther Corps and plays the trumpet. He has also received the Division I ratings in solo and ensemble for 3 years now. Damien is also a member of the Mariachi Pantera and the National Honor Society. He participates in baseball and track and is a part of DECA. Damien plans to attend the University of Texas at Austin and major in criminal justice and minor in business. He hopes to attend law school. How to big hand now for Damien Casas. Okay, if everyone can please rise for the Pledge of Allegiance and Texas Pledge. We face the flag that way. And whenever you are ready. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Texas Pledge. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible. Thank you very much.
Thank you, Eliza, Marina, and Damien. Thank you. And now we move on to item 5, awards and recognitions. Mr. Robledo.
Yes, let's do awards and recognition. This evening we would like to, and you know what? We have a photo we'd like to show you. Or do we have them in person? Do we have them here in person? Let's bring them on up. How about if we have a big hand for members of the jazz band at Weslaco High School as they enter the building. Finally have some students in person, which is good to see. This evening, we want to congratulate several Weslaco High School band students who recently auditioned and earned a chair at the All-Region Jazz Band. These students are, and as I say your name, if you could step forward, please, so we could recognize you. We have Isabella Sanchez, Jazz Band 2, 4th chair trumpet. Congratulations. We also have Raymond Sanchez, Jazz Band 2, 1st chair, tenor saxophone. Also, we'd like to recognize Anthony Ortiz, Jazz Band 1, 5th chair, trumpet, advancing to area. We'd also like to recognize Band Director Ramiro Leal in the back of the room. And if their parents are here, would they please stand and be recognized? Parents of our students. Once again, congratulations and good luck going to area. Good job. Thank you.
Congratulations, students.
Congratulations.
So we move on to item 6, proclamations.
Proclamations, I'll stay up here. We have several proclamations. We'd like to start off by recognizing and saying a few words about National Custodial Worker Day. And we have 3 of our custodians that are here today representing over 100 custodians in our school district. If they could please rise. 3 of our custodians. Whereas National Custodian Day encourages appreciation to the men and women who keep our schools and workplaces across the district running smoothly, and whereas Weslaco ISD has a custodial department that conducts custodial and maintenance duties for district facilities and properties, and whereas these workers operate behind the scenes and are often underappreciated for their hard work they do day in and day out. Whereas now, more than ever, custodial employees are on the front lines and contribute to the safety and well-being of students and staff. Therefore, Dr. Jaime Rodriguez, Vice President of the WISD Board of Trustees, does hereby proclaim October 2nd, 2021 as National Custodial Worker Day. Thank you. Okay. Up next, we have Texas Education Human Resources Day. Are any members of the HR department here? Anybody? Okay, well, maybe they're watching online, so we'll go ahead and give them a shout out as we read this proclamation. Whereas Human Resources Division is an instrumental in recruiting, selecting, resourcing, and retaining quality staff in support of providing an excellent education for all our students. And whereas Human Resources plays a key role in fostering satisfaction and loyalty among employees by allowing a professional growth and development and keeping employees informed about policies, working conditions, compensation, and benefits. And whereas Resources monitors and manages current, future workforce trends, organizational culture, legal, legislative trends, and ethical and social responsibility, therefore be it resolved that Dr. Jaime Rodriguez, Weslaco ISD School Board Vice President, does hereby support and proclaim October 12th, 2021 as Texas Education Human Resource Day. Next proclamation. We have Red Ribbon Week. Whereas National Red Ribbon Campaign will be celebrated in the Weslaco Independent School District during the week of October 25th through October 29th, and whereas the WISD and the City of Weslaco are coordinating this grassroots community awareness program in a united effort with representatives throughout the community, and whereas businesses, government, law enforcement, schools, religious institutions, service organizations, youth, medical, senior, citizens, military, sports teams, and individuals will demonstrate their commitment to drug and alcohol-free, healthy lifestyles, therefore be it resolved that Dr. Jaime Rodriguez, Weslaco ISD School Board Vice President, does hereby support and proclaim October 25th, October 29, 2021 as Red Ribbon Week. Up next, Dyslexia Awareness Month. Do we have dyslexia coordinator here or anybody that works with dyslexia students here? They are here. Whereas dyslexia is a language-based learning disability which often limits a student's ability to succeed in a traditional classroom setting, and whereas neurological in origin, dyslexia affects the way the brain processes information and is a leading cause of difficulties with reading, writing, and spelling. And whereas special education opportunities, including highly trained teachers, multisensory learning programs, and individualized instruction are vital to dyslexic persons' future success, therefore be it resolved that Dr. Jaime Rodriguez, Vice President of the WISD Board of Trustees, does hereby proclaim October 2021 as Dyslexia Awareness Month. Thank you. We do have one more proclamation, a lot of proclamations in the month of October. So we do want to recognize our wonderful principals. I know we have some that are here, and we have some that are online. So if you are here, can you please stand? Principals? All right. As school leaders, principals are entrusted with our most valuable resource, our young people. These students are our promise for the future, and it is our absolute critical that they receive a rigorous and well-rounded education. Principals are more than just caretakers of their schools. Principals are expected to be educational leaders, disciplinarians, community leaders, spokesmen, budget analysts, and guardians of policy mandates and initiatives. Principals set the academic tone for the school and work collaboratively with teachers to maintain high curriculum standards, develop mission statements, and set performance objectives. Therefore, be it resolved that Dr. Jaime Rodriguez, Weslaco ISD School Board Vice President, does hereby support and proclaim October 2021 as Principals Month. Congratulations. Thank you.
Thank you, Carlos, and thank you to all of our employees that are being recognized tonight. Appreciate all your hard work and your dedication to Weslaco ISD. Thank you so much. We'll move on to item 7, public comments.
I have one.
Go ahead. Dakota, you can speak.
Okay, hello?
Hello, can you hear me clearly?
Yes, can you guys hear me?
Yes, we can hear you. I'm gonna just read a few instructions before you start, okay? First of all, I'm gonna have you identify yourself and your address, and then I'll read you some instructions or some statements before you start. So go ahead and identify yourself.
My name is Dakota Mahoney. Can I not give my address only because this is posted online for the world to see and hear?
I'm sorry, but I've been instructed that you need to give your address.
Okay, 1613 Key West Drive.
Is that here in Weslaco?
Yes, sir, I'm sorry.
Okay, thank you. So let me just read a few comments here before you start. Pursuant to the Texas Open Meeting Act, the Board of Trustees may not deliberate on any comment made by a member of the public on a subject that is not included on the agenda posted with notice of this meeting. As per the Texas Attorney General, the scope of board discussion for a subject not part of the meeting agenda is limited to only a proposal by a board member to place a subject on a future board agenda. Specific factual information or recitation of existing policy may be furnished in response to inquiries, but the board shall not deliberate or decide regarding any subject that is not included on the agenda posted with the notice of the meeting. Audience participation at a board meeting is limited to the portion of the meeting designated for that purpose. At all other times during a board meeting, the audience shall not enter into discussion or debate on matters being considered by the board unless recognized by the presiding officer. No public comment presentation shall exceed 5 minutes. Any disruptive behavior by any speaker may result in the speaker's removal from participation in the meeting. Please be mindful of using names or personally identifiable information, as there is no immunity from defamatory comments while participating in public comments. And Coach Trevino is going to get you 5 minutes and let you know when you have 1 minute to go. You may begin.
Okay, I won't need the whole 5 minutes. I just had a question regarding the new Texas Education Agency guidelines that were released on Friday, if that is going to affect the mask mandate in the Weslaco School District.
Sorry, as per the instructions, we can't comment, and I think that's something that, is going to be addressed by Dr. Valdez at a later time.
Okay.
Okay. Thank you very much.
Thank you.
Thank you. So we'll move on to item 8, Superintendent's Report. Dr. Valdez?
Thank you, Dr. Rodriguez and trustees and members of the audience. This evening's Superintendent's Report, just 3-part series, 3 topics that we'll be talking about this evening. First is the COVID-19 update. We're closely monitoring cases in the county, monitoring cases in our city, and obviously in our district. If we can show first the COVID-19 data for Hidalgo County, we have the new daily COVID cases, hospitalizations, ICU, and deaths for our county up to September 17th. And you can see how the data there indicates from the data point September 7th to September 17th, we've seen a spike, although the cases just look at September 16, 275 to the 17th to 648, so we saw a spike in the active cases. And the net active cases in Hidalgo County up to the 17th were 2,370. Next slide, please. The Hidalgo County COVID-19 report, that bar graph indicates the COVID hospitalization out of total hospital capacity by percentage. And you see how that has been declining as far as the hospitalization, as far as cases requiring hospitalization. And you have other metrics there as far as the lab-confirmed patients currently in the hospital, patients in general beds, ICU beds, pediatric COVID-19 patients. And so you have that data as well provided for you. The next slide are Weslaco COVID numbers from September 7th to now and the deaths reported. And so you also see a spike from September 16th to the 17th from one day to the next in our city. Next slide, we have the Weslaco Independent School District summary of active COVID-19 cases. We have, as of yesterday, Monday, September 20th, we have 15,192 students. Active students, COVID-19 confirmed were 56 cases. Total Weslaco ISD staff, 2,278, and active staff confirmed were 6 cases. So we have 56 student positive cases and 6 staff. Next slide indicates the summary by school and our district. So you see the enrollment by school, the active student cases by campus, and active staff cases at each campus. And so you see the totals for each column indicated below. And so our COVID-19 protocols have determined to be effective. We did receive from TEA a public health guidance that was released yesterday regarding COVID-19 protocols and particularly the wearing of a mask. And so all the temporary restraining orders have been lifted. They are no longer in existence. Remember that the Hidalgo County had a mandate, and so there was a TRO, a temporary restraining order. And so we are in discussion of, because the public health guidance from the education agency indicates that the mask mandate is no longer in effect. It is optional. We highly encourage everybody to keep wearing the masks because it is the data indicates that these extra layers of protection are effective. And so that is something that we'll need to address as a Board of Trustees and as a school system. And I did seek legal counsel, and that the legal advice is that we must adhere to yesterday's TEA public health guidance. And so now the mask wearing will be optional, but we highly encourage it because it works. So that's the latest on our COVID-19 update. Next, we have the Weslaco Virtual Learning Academy. And so this is the latest information we can provide up to this point. Senate Bill 15 was signed into law. The last time we spoke about this at a board workshop, it was still pending the governor's signature. So Governor Abbott did sign it into law. And so now school districts may receive full funding for local remote learning delivered via synchronous instruction, asynchronous instruction, or a combination for only grades K through 12. So this does not include pre-K. The students must receive a minimum of 240 instructional minutes daily. Also, the number of students receiving remote instruction is capped at 10% of all enrolled students within the district. TEA did provide guidance. It's a 3-pronged test. It's a statutory test as far as meeting the criteria to be eligible to receive virtual learning and to be accepted into the Wesco Virtual Learning Academy. So they had to have passed the STAR assessments for each subject tested in that particular grade level. If they were not administered the STAR, then they have to be administered a different assessment to show that grade level proficiency has been attained in the Texas Essential Knowledge and Skills, which is our state curriculum that the state provides. So in lieu of students in Weslaco ISD who did not take the STAR assessments last year, we are currently administering the MAP. That's an assessment, it's a computer-based assessment that it's measures of academic progress or performance. Measures of academic progress. And so it measures, for example, growth or current performance level in reading, in math, language usage, and science. And so it's a really good indicator of how they'll do on state assessments. This test is administered to over 10 million boys and girls in the entire country. And so it's a highly effective, just one data point, right, that can be used. But this is what we're using as a beginning of year assessment to determine if they're ready to be able to meet one of the criteria, right, that the state has set forth. The second criteria is that they have had a number of unexcused absences that is 10% or fewer out of all the instructional days from the previous year, and that they earned a grade of C or higher in the foundation curriculum courses taken virtually or remotely in the preceding school year. So this is for children, for students who received remote instruction for more than 50% of the time last year. So
Dr. Valdez,
that's
I have a
the criteria
question.
we're using. Yes, ma'am.
For the kids who are not wanting to do remote, the kids who are at school, but they did not take a STAR test, will they be administered the same test here to see if they're going to have to take the extra 30 hours of learning, accelerated learning, or is it a different test for
We're
them?
going to test all our boys and girls with the beginning of the year map, so that way we
Okay.
can determine their current growth that's been happening and their current levels. So we will be administering that to give us more data on students' instructional levels or where they're currently at, and any learning gaps.
Okay, and if the kids don't pass this test, then they're going to have to do those 30 extra hours that are required, correct?
I believe so. For that, it'll be a metric that we use to diagnose and provide and then prescribe the treatment, if you will, right? For accelerated learning, whether it's extended days, Saturday camps, whatever additional learning opportunities to be able to close those learning gaps. Yeah, it's a way to evaluate. We assess and then we diagnose and then prescribe the treatment. Okay, next slide. Continuing with Senate Bill 15, we did get clarification from the state agency, state education agency. Of course, we're going to stick to the 22-to-1 student-teacher ratio in kinder to fourth grade. That's a state mandate. Students participating in a local remote program will count in the accountability system just as any other student based on the campuses they're associated with. At one point, prior to the bill becoming law, it was understood that we would have to set up a separate campus with its own unique campus ID number. That's no longer the case. They will still be associated with their home campus. So they're just their mode of instruction will now be remotely as opposed to in person. And then each school district will receive an A through F evaluation rating for the local remote program. So as an LEA, a local educational association, we're going to receive an A through F rating on that. On the next slide, we did provide you a link with Senate Bill 15 frequently asked questions, and that was provided September 16th, just last week. We're just now getting guidance from the state on the rollout of virtual academies. And to give you on the next slide, some data as far as how many applications were submitted. District-wide, we received 1,303 applications, as opposed to the almost 5,000 when we did the survey, the parent survey. Almost 5,000 parents expressed the wanting for their child to participate in the virtual learning. 1,303 applications were submitted. I think my theory behind that is that we're now into week 4, correct me, 5, losing track here, into the school year. The survey was done, week 1 of school, or just finishing week 1. And so I think there was still this uncertainty of how, with the health pandemic and how being around so many students and staff, how it would all, come to fruition, right? We anticipated spikes in the cases, and as we're now going into the first 6 weeks, we're noticing that it's not as much, I think, as far as the cases. We hope that it remains this way, but I think parents and community members are feeling quite at ease, maybe more at ease, that yes, we are doing the best that we can, the entire team, from custodial staff to faculty to administration, everyone just doing their part in guaranteeing those layers of protection, and so the data indicates that. And so I think that's my theory for them, from going from almost 5,000 to 1,303 apps. Of those 1,303 applications, 298 requests were for medical exemptions. TEA did provide a definition for what those medical exemptions could qualify a child, and you have the definition there of a medically fragile student. So they have to have a serious ongoing illness or a chronic condition for at least 12 months, or has required at least 1 month of hospitalization, and that requires daily ongoing medical treatments and monitoring. Require the routine use of medical devices or of assistive technology to compensate for the loss of usefulness of a body function needed to participate in activities of daily living. And finally, live with ongoing threat to his or her continued well-being. And TA does provide a note as far as some of the examples that qualify for the definition, right, of medically fragile. And so you have some examples there. But we are leaning on our medical staff, our nursing staff, to help us out with some of those conditions, to see if they qualify right under medically fragile students, because then we would be able to receive ADA funding for those children. And finally, the last slide on the Weslaco Virtual Learning Academy screening. That screening is going on right now. It's been happening all week. That's being done at the campus level, so campus administrators are working diligently and feverishly to screen each applicant at their campus. And so they receive like a total number of applicants. Then they, based on their screening, applicants who meet criteria as defined by Senate Bill 15. They have applicants that did not meet criteria as defined by Senate Bill 15. And then applicants that did not meet the criteria as defined by Senate Bill 15, however, parents are claiming a medical exemption. And then number of pre-K applicants, because remember, pre-kindergarten is not part of that 10%. It's only inclusive of kinder on up. And so right now we're in the screening process. Not until we have those final figures, then we determine the number of faculty needed. The concern we do have at the elementary level is the number of, if you will, teachers wanting to be faculty members in the virtual learning academy. Okay, so because we have, I'm going to give you the breakdown of how many we have. We have, this is prior to the screening. I counted 819 elementary applications submitted, 261 middle school applications submitted, and 202 high school students applied. So early on, the indication is that we do have enough middle school and I believe high school faculty who are willing to. Remember, we cannot coerce them to want to do this. However, at the elementary level, we're not seeing enough interest. So we're, right now, the executive level team, and we'll be meeting with principals, I think tomorrow, and coming up with a plan on how to possibly incentivize elementary faculty to join us in providing this service for the elementary students that will need it. Because some of these will be medically fragile students, and so we need to be there for them. We need to provide the service for them. Okay, that concludes the Weslaco Virtual Learning Academy presentation. And now we have the insurance. We have Mr. De La Rosa, who is now connecting remotely. Are you there, Mr. De La Rosa?
Yes, good afternoon, Dr. Valdez, Dr. Rodriguez, and members of the board. This is the standard insurance slide that we present every month. We have reached the end of our fiscal plan year for our self-funded employee benefit program, our health insurance. So this data represents September 1, 2020 to August 31, 2021. So even though we have reached the end of the fiscal year, there are still runouts that are being processed. Those amounts and those totals will be reflected in the 21-22 reporting period. So we won't have a really definite idea because of the runout claims of spend for the 2020-21 plan year until the end of November. But we'll get to that data as soon as we have it. So as far as medical claims, last year at this time we were at $8.2 million versus this year we're at $10.2 million. That's an increase of almost $2 million. For the prescription drug or RX program, we're at $5.7 million for last year. This year at $6.9 million. That's an approximate increase of $1.2 million. Fixed costs, which entail your stop loss premiums and administrative costs to actually pay, for the administration of the plan, what we pay Blue Cross. Last year we're at 2.6, and this year we're at $2.5 million. That's a little bit of a decrease of $127,000 this year over last year. And this is due to the premium credit that we did get last month. That was reflected in last month's presentation we got from Blue Cross and Blue Shield. It's about $150,000 premium credit that we received. So total at the end of the end of August 31st last year at this time, we're at $16.5 million. This year we're at $19.6 million. That's an approximate increase of 19% this time over last year. That $19.6 million is net of our stop loss premium or stop loss claims that we have received back. We have received approximately $3.8 million in stop loss claims. So in reality, we spent a little over $22 million. However, we did get reimbursed $3.7 million in stop loss claims. So the next slide just kind of gives you a representation of where we are in the claim trend for the medical cost. So as you can see that this year is indicated in red versus last year is blue. So as you can see in September, we saw a really huge spike in medical claims. And then it came right back down in November and it started coming down consistently until we hit March. We saw an increase, drop back again, and then it's been pretty consistent throughout the remaining plan year. But this, of course, is still an increase over last year. And of course, a lot of it we can blame COVID, if you will. And I'll have more information on what we spent on COVID expenses, and I'll send that out in the update. I just received that information today from Blue Cross, and I shared it with Dr. Valdez. Again, a little representation of the RX trend. We have seen significant increases in our RX spend, and that is due to the increased price of prescription drugs and then more utilization due to COVID. So that's going to be one factor that we look at when we look at these claims. However, we still have a healthy fund balance, and there was no need to increase employee or district contributions for this coming plan year. So we'll keep an eye on that, and hopefully we'll be able to keep things on an even keel, if you will. The next slide is the self-funded workers' compensation program. This is a snapshot of this year versus last year. So last year we had 70 claims at the end of August versus this year we've had 73. So we've incurred this year approximately $192,000 versus last year, which was a $270,000. Again, that shows the paid amount of $179,319 last year versus $132,962 this year. With outstanding reserves, this is money that we have to put aside to pay out the remainder of those claims. We're at $59,930.42 versus last year we're at $91,1796. So our workers' compensation program is doing very well. That concludes my portion of the superintendent's report. If anybody has any questions.
Thank you, Mr. De La Rosa.
I have a question. Mr. La Rosa, I know we, from what you just said, we finished out in a better situation than last year, than previously. My question is, why are we, why do we charge ourselves as far as when people go out, especially COVID-related exams? I know there was a CARES Act that compensated for that, or that would kick in if you don't have insurance, correct?
No, sir. The CARES Act did provide free testing and unfunded leave mandates at the beginning of the start of the pandemic, but that all expired at December of 2020, December 31st.
Okay, thank you.
Thank you, Mr. De La Rosa.
Thank you.
Go ahead and move on to, are you done?
Oh, before we move on, I think I false started. So I need to go back to slide 3. And we want to recognize some special departments that, they get the work done. And boy, I mean, they work diligently day in, day out. And we just want to recognize their efforts because we don't want them to know that it goes unrecognized. So we want them to know, and we tell them all the time, but we'd like to make it public this time. So, Mr. Sanchez, you have the privilege and honor, sir, to do that.
Thank you, Dr. Valdez. Yes, Dr. Valdez, Dr. Rodriguez, members of the board, I'd like to provide recognition since I did not have a chance to do it when we were presenting the budget, the adopted budget for fiscal year 2021-2022. I'd like to thank and recognize the departments of Business Office, Human Resources and Technology, the staff of those departments, as well as, and also Dr. Richard Rivera, who worked with PSP Consultants for the support and contributions for the preparation of the budget. As well as this last week, we had the first monthly payroll for the 21-22 year, and the Friday before then, the first bi-weekly payroll that had the pay raises for the new year, and it was a lot of work. We have about 100 new employees, and as you all know, we have a shortage in the Human Resources Department, so there was a big overload there. So getting the information from there to Business Office was delayed. So both departments, Business Office, Payroll Department, worked very hard on those two items to get both payrolls out. Then the Technology Department helped us a lot as well to get that. It was a lot of, the last 2 weeks prior to the payroll was the staff was working here late, even during the weekends. So I'd like for them to know, like Dr. Valdez said, for them to know that they're being recognized and that we appreciate their late hours that they stay working on that so that the staff can get their paychecks. We know we had some errors, there was a lot of work, a lot of new employees, like I said. We're working on making the corrections, so anything that was done incorrectly, we'll fix it. So we just need for people to let us know, the employees, and just to, again, recognize them for the hard work they did. for both the budget and the payrolls. Thank you very much.
Thank you.
Thank you, Mr. Sanchez.
Thank you.
Thank you. Anything else, Dr.?
That's it, Dr. Rodriguez. Thank you.
Thank you. So we'll move on to item 9, consent agenda. I'll give you trustees a few seconds to look through, see if there's any items you'd like to pull. I'll go ahead and start, Coach Nieto?
None.
Mrs. Ustaita?
None.
Coach Trevino? Need more time, Coach?
Item U.
You? The only one?
One.
You won.
Yes.
You won. Mr. De Los Santos?
None.
Mr. Gonzalez?
None.
Okay, now I'll entertain a motion.
I'll make a motion. For the
Second.
consent agenda excluding U1.
Second.
I've got a motion to approve the consent agenda excluding U1 by Mr. Andrew Gonzalez, and a second by Mr. Isidro Nieto.
Yes, sir.
Was that you, Coach?
Yes.
All those in favor, say, well, let's go one by one here. Coach Nieto?
Aye.
Jackie Susaita?
Aye.
Coach Trevino?
Aye.
Mr. Los Santos?
Aye.
Mr. Gonzalez?
Aye.
Motion passes. We'll go ahead and, Coach, U1?
My concern here, or my question, I know yesterday I voiced some concerns, and I would just like for us to consider changing, if ordering less than 3,000, instead of requesting only one quote, I would like to request 2 quotes. Because I don't understand if it makes no, I mean, it really doesn't make sense. So if we're ordering $2,900 or you're ordering less than $3,000, we're still selecting, let's say I select O'Reilly Auto Parts and I ask them for a quote. So is it really, who are we comparing that quote to once we get that quote?
Okay, we can do that.
No, it's a question, so.
No, there's only one, none.
The way it's written right now, it doesn't make sense, and it's not really just for this, it's for the entirety of the way we do our bidding process, because I noticed the same, phrase on a lot of other, expenditures. So if ordering less than 3,000, one quote, only requesting one quote, so I'm still selecting the company, correct?
Yes,
So why even have a quote?
and just so we know how much the parts are gonna cost us, whatever we're requesting.
No, I don't understand.
It's just so that we know how much the parts that we are requesting are going to cost us.
Okay. I would like to implement a 2-quote system
Sure,
on that.
we can do that.
We can make the motion for that.
Yeah, so I would make a motion to go ahead and implement a 2-quote system for anytime we order less than 3,000. But, and this is for this, but I would like to apply it across our whole system.
We'll bring that up in the future for future agenda items.
Okay.
Second.
Okay. I have a motion by Coach Trevino to change the quote to 2 quotes.
2.
Instead of one for anything in the amount less than 3,000? Under 3,000. And then I have a second by Coach Nieto.
Yes, sir.
We'll go ahead and take it to a vote. Coach Nieto?
Aye.
Mrs. Ustaita?
Aye.
Coach Trevino?
Aye.
Mr. De Los Santos?
Aye.
And Mr. Gonzalez?
Aye.
Motion passes. And we'll move on to item 10, discussion items. Dr. Valdez?
Item 10A, we have the first reading of Policy Update 117 from the Texas Association of School Boards. No action is required for the policy update. We do have staff available. Dr. Sergio Garcia, should you have any questions?
Anybody, any questions on those by the trustees?
I haven't. None for me.
No? Okay. We'll go on to item B.
Item B is the interim financial report for the 12 months ended August 31st, 2021. So this is just for you to acknowledge the report as prepared by the business office. No action is required.
I have a quick question, not on this, but looking back at agenda item V as a Victor, Cintas Corporation Mercedes is listed on there. I know I voted for the entire deal, the entire packet here, or section, but I do work with Cintas, so I just want to bring that out, just put it out there that way.
That's fine.
Is that enough, Mr. Sepulveda?
That's fine.
Okay. Thank you.
Okay. Dr. Rodriguez, Dr. Valdez, members of the board, this is the report is for the 12 months ended August 31, 2021. In the general fund, the local revenues are $24,909,000. State revenues, $139,787,000. And the federal revenues, $13,852,000. Total budgeted revenues is $178,549,000. Most of the revenues in the general fund are from taxes. The current taxes through the August 31 report that we received and that we have recorded in the budget at $24,569,542. That budget was 106% more than we had budgeted. So we went above and beyond in tax collections. Next slide, please. From the state revenues, the largest revenue item from the state revenues is the ADA, average daily attendance, as you all know. TA helped school districts with the whole harmless provisions that they provided to all of us, and we received the advantage of those provisions, so that helped us with the state revenues. On the federal revenues, I had mentioned before that we were anticipating $900,000 deficit in the food service fund because of the low participation, because having less students coming to school in the meal that we were serving. In the end, we ended up with only a $451,000 deficit because we received $1,004,000 from the state. They called it COVID-19 relief funding payment from the USDA and the Texas Department of Agriculture. So that helped our food service department to just make it at $450,000 short as opposed to $900,000 short. From the total revenues on the next slide, local revenues received, taxes and interest and other items are $26,840,000. State revenues, $139,180,000, and the federal revenues altogether is $13,523,000, for a total of $179,549,078. Next slide, please. On the expenditures, we throughout the year we had many budget amendments that came to the board, and we have a reconciliation to present in the next slides. The total amended budget for expenditures was $189,762,045. We broke it down in 5 sections. The first item is instruction and related functions. The budget was $114,531,000. We expended or encumbered, that means we did purchase orders, $103,489,000. That includes also salaries for all those items. That was 90.36% of the budget as amended. For instructional support, which are the next functions, which are 32, 33, 34, 35, and 36, of an amended budget of $28,421,000, we expended or encumbered $23,869,000, which is 83.98%. Administration, which is central curriculum and instruction, campuses, and district administration, we budgeted $15,331,000. We expended or encumbered $14,127,000, which represents 92%. On the district-wide support category, out of functions 51, 52, 53, and 61, of amended budget of $28,910,000, we expended or encumbered $24,750,000, which is 85.6%. And then on the payment of debt, which is in this fund, the maintenance tax notes, we had budgeted $2,568,000. The payments of principal and interest and fees was $2,536,000, which is most of the budget, 98.7%. The total expenditures and encumbrances, without the accrual of payroll for the staff, like teachers that started working in August, that has not been reflected yet. It's $168,773,000, which equals almost 89%. Once we record the accruals of the payroll, that amount is going to go up. The next pages are the reconciliation, which explains why our expenditures are higher than our budget, and I had mentioned that before. And I'll touch on the highlights of the higher amounts. The first one is a carryover of state funds. These are the money that the state gives us that we have to spend a certain percentage of the category of funds. And if we don't spend it, we have to save it in a particular fund balance account and roll it forward the next year so we can spend it. The state gives us 3 years to spend these funds. So from all the funds that we roll forward from the prior years was $5,561,000. We also roll forward from purchase orders that we had encumbered monies, items that we ordered, and we did not receive them by August 31 of 2020. That was $1,228,000. The board had approved an amendment to allocate money for PPE, sanitation, items like that, in teacher and student desk use of $620,000. Then there was an employee incentive pay that was made in December, which took $2,323,000. And the last item there that is large is the food service fund balance. We increased $1,215,000. To add to the budget we wanted to make sure that we did not go over in the expenditures over the budget. And this money came from their own fund balance, not from the district's unassigned fund balance. And the next page, on the second item, we have the portable air cleaning units to be used district-wide. These are the ones that are in the classrooms, and we'll be getting into the libraries, cafeterias, and other areas. It's $1,749,000. This money came from fund balance, like I mentioned. The fourth item, additional budget, a budget allocated for cleaning and disinfecting supplies for classrooms and departments of $750,000. We did not spend not even half of this money last year. So we put it in. The money that did not get spent will go back to fund balance at the end of the year. It will be reflected in the audit once we present it. On the next slide, the fourth item, there was an additional employee incentive pay. This was done in June, which the board approved after we clarified some items on it, and that took $2,323,000 from fund balance as well. When we did the final amended budget for the general fund, we did some reductions on some expenditures. In the end, expenditures were reduced by net $3 million, and that the expenditures for the year in the budget ended up being increased by $13,985,000. The next page shows the final reconciliation. The initial budget of expenditures was $175,776,000, where the amount I just described of $13,985,000. Our amended budget on expenditures was $189,762,045. There were also some amendments to the operating transfers out. We had made some transfer to the construction fund, $159,528, And then on the last board meeting on the August 25th, the board approved to transfer $2 million to the debt service fund for the payment of bonds. So the amended budget on transfers out was $2,159,528. That is the report for the general fund. Any questions on that? I know it was fast, but that is the report we have. Once we have the audit report, we'll have better numbers. Right now, like I mentioned, we don't have the accruals for payroll. We're still working on invoices from schools to clear all everything. Items that don't come in by August 31, those purchase orders get closed and they get added to the fund balance, and we'll roll it forward again probably in October. And we did some already in this month.
So, Mr. Sanchez,
Yes, sir.
you mentioned that there going to be a possibility that there'll be money placed in the fund balance because of the expenditures from this year?
Yes, yes.
But it closes August 31st, correct?
August 31st, yes, sir.
Okay.
Thank you, Mr. Sanchez.
Thank you.
So we'll move on to, item C, right? Item C, under discussion
Yes.
items.
Item C is acknowledgement of Hidalgo County Tax Office Collection Report for July and August 2021. Current taxes and delinquent taxes. This is for you to acknowledge, and no action is required, and we have Mr. Sanchez available.
Yes. On the July 2021 report, from the current taxes, which is the current levy, through July 31, there was a collection of $24,917,918. There were $360,975 of adjustments. Those are the increases to the tax roll. And that was a 95.72% collection. Last year, as of July 31, we had collected 95.08. So the collections for July were 0.64% higher than the prior year on the current levy. On the delinquent taxes, which is the prior year levies, the collections were $1,084,247. There were $140,916 of adjustments decreased. So those went down. The total collected was 26.82. The prior year was only 19.21. So delinquent taxes went up by 7.61 as of July 31. For the month of August, the current taxes, the total was $25,061,474, with almost the same adjustments of $360,000 increase. The total percentage at the end was 96.28. The prior year was 95.38. So current taxes was 0.9%, almost 1% more collection than the prior year. The budget that we had for current taxes was 92%, so we exceeded the budget by 4%. That helped our budget, and also that will help with fund balance, more money at the end of the year. The prior year levies, total collection was $1,167,754. The adjustments was a decrease of $140,000. The percentage at the end was 28.89. The prior year was 20.26%, which is 8.6% higher than the prior year. The budget was only 10%. This is the one year that we were afraid whether we would collect enough or not, so we budgeted only 10% being conservative. We ended up getting almost 29%. So tax collections were very good for Weslaco for 2021. That is the report.
Thank you. Thank you, Mr. Sanchez. So we'll move on to item 11, discussion and possible action items. We'll start with A, discussion and possible action on nominating candidate to serve on Hidalgo County Appraisal District Board of Directors for 2022-2023, and approval of resolution for nomination. Dr. Valdez?
As a governing body of a taxing unit, you are entitled to nominate candidates for the Board of Directors for the Appraisal District. Members who are elected will serve for a 2-year term, and this begins January 1, 2022. You have a list of the individuals before you. Weslaco ISD does have a total of 140 votes, which can all be cast for one candidate or distributed amongst the candidates that will be nominated and named on the ballot. And so you'll be able to cast your votes, and then you will have to approve the resolution for the nomination.
I'd like to nominate Joe Olivares. I think that's somebody from Weslaco, so I just,
Second.
What was the name again? Joe Olivares. I have a motion by Jackie Sustaita to nominate Joe Olivares, and a second by Andrew Gonzalez. Any discussion on this?
Mr. Sepulveda, I know Dr. Valdez just mentioned we have 140 votes. Do we have to put that in the motion that we give them all the votes? Ms. Jackie, do you want to?
yes, I'll rescind my motion, and I'll make a motion to give all 140 votes from Weslaco to Mr. Joe Olivares.
Second.
So we've amended the motion to include the entire 140 votes for Mr. Joe Olivares. Motion by Jackie Sustaita and the second by Andrew Gonzalez. We'll go ahead. Any further discussion on this? We'll go ahead and take it for a vote. Cotiato?
Aye.
Mr. Sustaita?
Aye.
Mr. Trevino?
Aye.
Mr. De Los Santos?
Aye.
And Mr. Gonzalez?
Aye.
Motion passes. Item B, discussion and possible action for the board to consider the selection of a telemedicine service provider, RFQ number 22-09-03. Dr. Valdez?
Yes, we did have a board workshop prior to the board meeting on the one vendor who provided a presentation on the telemedicine service for you to consider. While I appreciate her description of the service being provided as something swift that our nursing staff can perform, I value the feedback and input from our nursing staff. And so, although they felt that it was a good concept, they unanimously agreed that now is not the appropriate time to implement such a program. So administration recommends no action at this time on the selection of a telemedicine service provider.
So move.
Second.
I have a motion by Mr. Nieto to take no action
Yes.
on item B, and a second by Mr. De Los Santos. Do we have any further discussion on this?
Yes, I would like to say something. I have been looking into this a lot, very deeply, and the policies that we bring to our school districts, obviously a lot of other school districts in Region 1 do have this program in their school system. And I'm looking at something in front of me here in dissertations and research, and it's not based on my personal opinion, but based on research. Even though our goal is to provide our kids with a strong educational foundation in school, a lot of times we're unconsciously doing inequitable things for our kids when it comes to health policies. And so what I've been reading, yes, it helps student achievement, it helps scores, it helps absenteeism. There are research that has proven that doctors' visits aren't lessened. Our healthcare providers, our local healthcare providers don't have less business because of this in the schools. So I understand that the nurses might feel like it's added work, it's an added workload. I definitely understand, but at this time, I mean, we're all facing added workloads. The teachers are, the principals are, everybody's facing added workloads, and it's all for our students. And I understand that the feeling of looking at it as in it's too much, but my opinion is that this would be a great benefit, and if not now, if you don't agree right now, then hopefully soon we can.
Right. And we respect Mrs. Sustaita. We agree, right? We agree as a school system, of course, as the nursing staff would to agree, right, that it benefits our children. It benefits, I mean, yes, the reasons that you mentioned, right, as far as student achievement and of course their wellness, right? We think of the whole child, and absolutely we want to provide that kind of service. And I would hope that one day we do get to that point. But it was their input, right, as far as the timing. It's all about the timing. And maybe possibly not being in the midst of a public health crisis, their feedback would be different. However, I respect their input as well. And of course, hopefully one day we can move forward and provide this beneficial service to them, to all our children.
Thank you, Doc.
For me, I really wish we could have implemented something like this just because it's optional. It's not mandatory. So by it being optional, you can choose to use it or not at each respective campus. So I think the program itself offered some leadway there to implement it, see how it works at a specific campus, just because it's optional. I think that word should have been taken into consideration or more seriously. And,
Yeah.
Why not? There's 53 other districts in here in Texas using it, and why not experiment with it? Why?
Right, we could, Coach, and I agree, we could do a pilot study as far as piloting it in our, in a campus or two, start small, like she noted too, that we had that option, right, to not do a rollout, a district-wide rollout, but we could implement a smaller, the scope be more limited. And we can do a pilot. I mean, we can look into that and see if there's a campus that possibly wants to proceed with that, and then we use that data to evaluate. So.
Yes, if I can say, I agree. What I've been reading, it says when you concentrate and focus on certain grade levels, not everybody, but just focus and concentrate on certain grades, even during the pandemic. This article that I'm reading is during the pandemic. It worked great, health-wise. So focusing it on only certain grades, like you said, a pilot program, I think that would be something that that would work, hopefully.
We can look into that, so we'll have administration proceed with the
Yes, ma'am, and
recommendation of a
especially now
pilot.
that with that new guidance that we're saying that we're not going to require masks anymore, I mean, we're taking that away already.
Right.
I'm already getting messages of, well, how are we going to be going to school without masks? What are we going to do? I'm getting the panicking messages already. So we're taking that away. So if we have this program that is optional, that's absolutely free, why not say, okay, let's try it here and there? We're already taking something away. Why not give something back into the district to say, we're taking this away, but here's something else that can help us out so you can feel safer?
Yeah, so what we'll do is the next steps is poll our principals and along with their nurses to determine who could and wants to participate in that pilot. And that way, that will give us more information on proceeding maybe in a larger scope.
Yeah, especially when they're going to offer all the resources and they're going to offer all the assistance. And,
Yes.
and for me, just having our neighbors be a part of it and here, us used to be the tone setters, not wanting it, I don't know, I think there's ways to do
Started
things.
with a smaller scope.
Yes.
Thank you for that feedback.
Any further discussion on that? We've got a motion on the table by Mr. Nieto and a second by Mr. De Los Santos to take no action on item B. We'll go ahead and take it to a vote. Mr. Nieto?
Aye.
Mrs. Slaita?
No.
Mr. Trevino?
I abstain.
Abstain. Mr. De Los Santos?
Yes.
Mr. Gonzalez?
Aye.
Motion passes.
But we will continue the work in that pilot study.
Go on to item C, discussion and possible action for the board to consider approval of a one-year extension award option for embroidered items or authorize administration to solicit proposals for embroidered items, proposal number 20-08-27. Dr. Valdez?
Yes, this agenda item, you're going to have the option of either extending a one-year extension award option for the embroidered items to the vendors that were already approved in the August 2020 board meeting, or you can authorize administration to solicit proposals for this service. And you have a list of the approved vendors that were approved last August 2020. And these embroidered items are purchased by district administrators for students and staff as a reward or as an incentive for their hard work and dedication. And then you have noted there that all 5 vendors were designated as primary vendors, and so they have the option of selecting any of those vendors. And then you have the changes in the recommendations of amounts to be 500 as follows. For purchases less than 500, we get 1 quote as required from any of the 5 vendors, and for purchases of 500 or greater, a quote must be obtained from any 3 of the 5 approved vendors.
I'll make a motion to approve the one-year extension. However, for anything less than 300, not even the 500, kind of like what Coach Jesse was discussing earlier, even if it's $500, at least get 2 quotes.
Okay.
I'll second that.
So I have a motion to.
I second.
We got a second, Mr. Los Santos. Got a motion by Mr. Andrew Gonzalez and a second by Mr. De Los Santos to approve the one-year extension award option for embroidered items with the specification that 2 quotes required.
Anything less than 3,000.
Or 300.
300.
We were changing it from 3,000 to 500.
Yeah, they changed it to 500, they said 300.
The 500, anything less than the 500 needs to have 2
It's okay, 2 instead of 1, okay.
Two
Yeah,
quotes.
instead of 1.
Okay.
2 quotes,
And then
anything less than
500 or more, they will go with that
you
3
get at least
quotes.
2 quotes.
Okay.
Since it's already
Okay.
300 here, so-
Any further discussion on that?
I just want to, yes, I want to make a comment. And it was something that we discussed last night. What is going to be the cap? I mean, we have issues when you're spending more on embroidered shirts than you are on instructional resources. And I'm just going off of the numbers of the budget and what was in the audit report.
Yes.
We're budgeting 500 to 600,000 a year, mostly in the 500 range, and then we're spending 800 to 900,000 on incentives. So my question is, and then if you look at the instructional resources that are budgeted, you know, you're in the $600,000 range. That just seems to be backwards to me. So what are we going to do about that? Because the funds that we're using, those are local funds, correct? The majority are local funds.
Right,
'Cause state
all local funds.
Right, because state and federal don't allow that.
Right.
So with local funds, those are the taxpayer dollars. I mean, those are coming from people's residential taxes, and it's supposed to be for instructional. And so, what are we gonna do about that? Not that we're gonna approve this, I don't have a problem with it. I know other districts have different methods where they don't buy embroidered shirts or caps or jackets, and they offer forms to their staff where they can then order it, kind of like the photography, the way we do it with our students. I know districts that implement that, especially after they've been audited, that they've moved to that and implemented that, where they allow their staff to choose from different vendors and they had order forms. Here, we're buying it with taxpayer dollars and giving it away. So my question is, what steps are we going to take? Is there an action plan? Has that been reviewed?
Well, I mentioned yesterday that we put a limit of $25 for the item, whether it's embroidered or not.
But
It probably won't have a lot of embroidery, or it won't go that way.
Right.
Because $25 is not a lot of money for an embroidered item.
Right.
So we put a limit of $25 per employee per semester, so no more than $50 in
A
the
year.
year.
Okay.
And in the past, we didn't have that.
And you said that's allowable. That's an allowable
Yes.
expenditure.
Yeah, anything, according to the IRS, they call it the minimum rule of $25. Anything that's higher than that, if we were to get a shirt that is $40, we're supposed to add it to the W-2 of the employee's compensation, and we don't do that. And no district does it. I'm not aware of anybody that does it, but some districts say that they will do it if it happens. And that refers to anything that has to do with shirts, athletics, teachers, any other stuff.
I did mention to Mr. Sanchez last night, that an option would be to omit and no longer purchase shirts.
We can stop that too.
I
That's
think
an
it-
option.
I
For
think
students
it's
and
just
staff.
within reason, that's the only thing, because it's alarming when you're spending, like I said, if you look at the history, the past expenditures, 800 to 900,000 on incentives, but yet we're spending less on instructional resources. It
Okay.
just kind of looks
So,
backwards to
Would
me.
you like me to reduce the amount to 15 perhaps?
I think what we can do, and something that Dr. Valdez can look and evaluate with the staff, is put a percentage at each campus of how much they can spend in incentives, you know? Instead of having, whether it's $25, but put a percent out of the budget that that each principal, because principals allocate that amount in their budget, correct? And I understand what you're saying, Mr. Los Santos, they should go more instructional, and I guarantee you the principals do put a lot of money in instruction. But at one time, you got to remember that this was incentives for teachers, so, you know, they could do better in the classroom, and that's what we're here for. And I know Mrs. Valdez said we can omit it, okay, but let's think about it first before we do that.
Yeah,
But, you know,
and I'm just clarifying, I'm not putting it on the principals, because the principals don't make up the district budget. The business office and the administration, the superintendent does.
That's
So-
okay, you tell me.
And I know that even in the report too, you'd see principals didn't ask they didn't reach out and ask for, you know, the allotments that they would get in the holidays. Sometimes they were just notified, here's the funds, go ahead and order. So, you know, no, by no means am I saying it's the principals, but I'm saying as far as the district and the administration, the business office, when we're looking and we're allocating funds, when that budget is being created, at some point, somebody decided that it was more important to put into incentives than it was instructional resources, and that's kind of the red flag for me. And so that's why I just wanted to highlight.
Yes.
The money that I mentioned yesterday that we provide to the schools is the money for the students, and we only do it once in the year. The rest of the money that went in the budget that you all approved, that is money that the principals and the department directors put it in the budget. We didn't do it.
Right.
We just tell them, you tell us that we want to take it all to the board, so the board approves it, the board, see, everything we don't want to do amendment during the year. So I told my staff, and my staff told the principals and directors, anything you want for awards for the year, put it in here so the board can approve it.
And
And that is their budget. They allocated whether it was to the librarian, to the principal, to the nurse, to the counselor, they decide.
Mr. Los Santos, and this came into effect actually back in 2001, I think. That's when I was at Mary Hope Middle School. This is where it began. And, you know, former superintendent felt that, you know, students deserved because they were doing well.
Right.
And he knew that he was poor, and he never had Christmas gifts and so forth. I don't know if Dr. Valdez was
Correct. I
principal already.
recall that.
And so that's how it came into play. You know, and I understand what you're saying.
Right.
But again, it's unanimous, whatever Dr. Valdez and the board decides, we can go forward.
That was the holiday incentive. Awards and incentives, though, principals will allocate monies for teacher appreciation, end of the year awards.
Correct.
6 weeks awards, should they have the awards assemblies. It's not just shirts. It is,
Right.
the
Trophies.
scope is yes, it's extensive. You're talking about end of,
Embroidery, and that's kind of the issue there. That's why. So
was it for the embroidery?
About
The
500,000.
stitching only, or
No, the
awards
company.
and
No, no, the
incentives?
company.
Yeah, the yearly amount
It-
spent out of the incentive funds, a good percentage of that was going to embroidery, so to shirts and giving things away. So that's all I wanted to highlight, though. It's instructional
okay.
resources.
I don't know the details, but I know the company,
Yeah.
it was about
Embroidery Express
500,000.
was- Yes.
I know because I looked into this. We spent $429,000 in 2020 with Embroidery Express. So my concern, just, and, you know, it looks good to ask for 2 quotes. I think that'll control that a little bit better. But for my sake, or just to keep things with integrity here, I would, but I know there's been a motion already been made here, so.
You know, in regards to the holiday incentive, you know, I know some of these students, that's the only gift they might get during Christmas time. And I know I've seen them wear the, you know, hoodie or sweater for, you know, months at a time, and they really make full use of that. So, you know, I know it's an expensive item during that time, and one vendor, whether it's Embroidery Express or somebody's gonna get that work, you know, but, you know, I like the idea. You know, I think it's still a good incentive for our students.
Minimizing it to $25 is good.
But let's start with that.
That's
I
what
think it's
heard.
harder to find something for $15. But again, you're leaving it to the principals as part of their budget.
Okay.
And
Correct.
so they can decide, and then we can always look down the road, and we have 5 vendors. And I know it was said last night, but I am not related to Embroidery Express, just to clarify, not related, no blood relation.
I know, that was yesterday's conversation, though.
I know, but you brought it up tonight, so I just wanted to state that since I can say it.
So we've got a motion for item C to extend the approval for 1 year with the 2 quotes for under $500.
Yes.
And motion is by Mr. Andrew Gonzalez and a second by Mr. De Los Santos. We'll go ahead and take it to a vote. Mr. Nieto?
Aye.
Mr. Staita?
Aye.
Mr. Trevino?
Aye.
Mr. De Los Santos?
Aye.
And Mr. Gonzalez?
Aye.
Motion passes. Item D, discussion and possible action for the board to consider approval of substantial completion for the design and replacement of the HVAC controls project at Weslaco East High School, CSP number 20-01-07. Dr. Valdez?
The primary scope of this work consisted of upgrades to HVAC control system at Weslaco East High School. The completion of the project is underway and will be presented to the board for approval once it's finalized. We do have Mr. Americo Garza available should you have any questions.
How old are these HVAC controls that we're looking to replace?
The ones that were replaced there, they're original to the campus, Coach.
So-
They're back from 1999 or so, original to the campus construction.
First graduating class was 2000.
So what happened here, and that's the other thing that we submitted through the ESSER funding, we still have some remaining campuses around the district with these controls. The company, the manufacturer of the controls, made them obsolete, and so they moved to a different product, and they came up with a different product to replace this one. And so we're still having to use these controls until we move on and replace them.
Are we looking to purchase these from that same company that,
So what we've done in the past, and typically what we do now, is we have 2 companies in the district to bid them against each other. Ideally, that's the ideal situation. We've had in the past as many as 7 to 8 controls companies, different controls companies, and it becomes a nightmare in terms of training, in terms of the learning curve for each control system, in terms of managing and maintaining them on the workstation. So, and then the service for them, and so it's really not the ideal situation. So we narrowed it down to 2, and so we make them compete against each other when we go out for bids for.
so we do request 2 quotes? Or
Yes.
a quote from each?
Yes, we do. There's some situations where we have already the controls partially in the campus, and so the preference there is to go with that company to make sure that the campus is under that same control system. But we have had, like in this case, we had the band hall brand new, and we had at East High School, and we had the remodeling of the athletic facilities that are also brand new, and so we decided to leave the new controls of the previous company that was there, that has the obsolete control system, and so we went with the low cost, which is the other company that we're using, which is Automated Logic. So we have Schneider Electric controls, and we have Automated Logic controls.
By HVAC controls, Americo, what do you mean HVAC controls?
So the controls allow the air conditioning systems to function, to talk to each other, different components. We have chiller systems, and they function off of cooling water and supplying that cold water as low as 44, 42 degrees Fahrenheit into the air handler, which is the one that has the blower, into the radiator, so to speak, the evaporator coil. And then the fan is the one that passes air through that evaporator coil, and the air cools down because of that cold water going through there. And so that's how we air condition. This is just one of the systems, and so to control that and the different components, we have to have controls. We have to have circuit boards, we have to have sensors, just much like the new cars that we drive nowadays. So we have to have everything in sync and scheduled properly and making sure that the system, the different components are talking to each other.
Now, are we replacing because we're having they're getting damaged frequently, or are we just replacing because
No, in this case,
reached a certain year?
In this case, it's because we had to replace the obsolete control systems that were there. And so the manufacturer is no longer supporting that system, that product. They're moving on to a new product. And so we went out to bid, and we got the two manufacturers that were using, Schneider and ALC. And so Schneider's the one that has the obsolete product. ALC ended up getting the.
I guess that's my only concern is, what's to keep us from being in the same position 12 years later, where they're obsolete and we're having to replace
one of the things that we're doing
system.
with at least now with Automated Logic came into the district back in 2014 when we did the energy conservation project under the Integral, which was mentioned on the report, the audit report. And so through that energy conservation project, Automated Logic was able to convert or upgrade, I believe it was around 8 to 10 schools, control systems for 8 to 10 schools. So we had Automated Logic and Schneider's product became obsolete. But with Automated Logic, we entered into a service contract where we continuously upgrade the system. Anytime they produce an update to their software, then they give it to us, and we're staying current with the system. So we're trying to make sure that we don't get to a point where we stay behind and we fall back on the versions of the software and also the hardware as well.
I know, I understand. Now that you explain it, I understand, but I'm still, what's to keep us from 12 or 13 years down the road having to be in the same position and having to spend $400,000 to update?
Well,
again, is that something normal?
Yeah, unless we fall into the same situation where the product is being made obsolete by the manufacturer, then really I don't see how we can get into that. Again, they do move on and they provide different products and so forth, and then they leave behind certain products, and that's when we sometimes get stuck with the obsolete products, and that's when we have to change.
Okay, now I notice, what's the engineering firm on the back? Trinity?
Yeah, so this project was done under a design-build method of construction, and so by law, we have to hire a consulting engineer to help us as a watchdog, per se, with this project. So we go directly to the contractor or the vendor of the product or the installer, and they provide sealed drawings for us, and then by law, we have to hire a consulting engineer to help us with the project. And Trinity Engineering is the consultant.
Okay, thank you.
Thank you, Perigo. So for item D, I'll entertain a motion.
Move to approve.
Second.
I have a motion by Mr. Gonzalez and a second by Mr. Nieto.
Correct.
Any further discussion? We'll take it to a vote. Mr. Nieto?
Aye.
Mrs. Staita?
Aye.
Mr. Trevino?
Aye.
Mr. De Los Santos?
Aye.
Mr. Gonzalez?
Aye.
Motion passes. Item E, discussion and possible action for the board to consider approval of the contract for the installation of 24 poles with LED light fixtures at Beatriz G. Garza Middle School, including an extension to the completion of the project CSP number 21-07-38. Dr. Valdez?
The board approves Zetro Electric LLC for the construction of this project. The poles for the project are specified to be aluminum, and that's why they're asking for an extension in the time frame, because the market for aluminum products is currently backlogged, resulting in long delivery times. And so the project is, the timeline now is to move it from 5 months to 11 months. with the ending date of June 6, 2022, and the contract has been submitted to review by our legal counsel.
Motion to approve.
Second.
So for item E, I've got a motion by Mr. De Los Santos and a second by Mr. Gonzalez. Any discussion on this? We'll go ahead and take it to a vote. Mr. Nieto.
Aye.
Mrs. Taita.
I'm going to abstain because this is one of our customers, so I'll abstain.
Thank you. Mr. Trevino.
Aye.
Mr. De Los Santos.
Aye.
And Mr. Gonzalez.
Aye.
Item F, discussion and possible action to rank the engineering firms previously approved by the board to select engineering firms for upcoming projects. CSP number 21-06-31. Dr. Valdez?
The board approved all the engineering firms that you have listed there for the various services needed, like structural engineering, MEP, mechanical, electrical, plumbing, and civil engineering. However, you did not approve the ranking for subsequent selection of engineering firms for the purposes of the assigned projects. So you need to do that this evening as far as the ranking. The projects will be assigned to an engineering firm as they are approved based on the corresponding engineering discipline required for the project, and in the order of the engineering firm is listed on the options presented. So you have two options. Option one is, do you want to arrange them, rank them in alphabetical order? Or option two is, do you want to rank them in alphabetical order with the firms currently working for the district at the end of each list?
I move to go with option 2.
Option 2.
Which is currently working for the district at the end of each list. To be fair.
Okay. Do I have a second?
Second.
So I have a motion to approve option 2, which is arranged in alphabetical order with the firms currently working for the district at the end of each list.
Correct.
Any discussion? For motion by Mr. Nieto, second by Mr. Gonzalez. Any discussion on this?
So basically, any project that comes up, whoever's next is the one that's gonna take that job?
Correct.
What if it's requesting,
Civil.
I guess, I mean, they're already divided up into categories.
Yes, into the services.
The only one that would come into play would be civil engineer.
Civil.
That's the only one.
Yes. Okay, thank you.
Right?
We'll go ahead and take it for a vote. Mr. Nieto.
Aye.
Mrs. Taita.
Aye.
Mr. Trevino.
Aye.
Mr. De Los Santos.
Aye.
Mr. Gonzalez.
Aye.
Motion passes.
Thank you.
Go on to item G, discussion and possible action for the board to consider approval of a COVID-19 vaccine stipend for all district employees to be paid from the American Rescue Plan ESSER 3 grant funds. Dr. Valdez?
Due to the COVID-19 pandemic, the expectations for all district staff to perform duties in a face-to-face environment, we highly encourage everyone, all our staff, to get fully vaccinated. As of Friday, as of Friday.
Sorry.
Jackie was going to say something, but go ahead.
Oh, okay.
You got it.
Okay. As of Friday, this past Friday, we have 2,270 staff members. Staff members would meet the requirement by voluntarily uploading a copy of their proof of the vaccination or uploading a U.S. licensed medical provider approved vaccination waiver. Due to the requirements between first and second doses of the vaccine, staff members will have until October 31st, 2021 to complete the vaccine process and upload their documents. Any new employees hired between October 1st, 2021 and April 30th, 2022 will have 6 weeks from the date of hire to complete this process. And it's the expectation that the stipend will assist in maintaining the safety of our staff and students throughout Weslaco ISD during this time. And so administration recommends a $500 vaccine stipend for each per staff member.
Motion to approve.
Make a
Second.
motion.
Got a motion by Mr. De Los Santos and second by Mr. Gonzalez to approve the COVID-19 vaccine stipend for all district employees to be paid from the American Rescue Plan ESSER 3 grant funds. Any discussion?
Yeah, Dr. Valdez, I just want to make it a point, we're not forcing them
Correct.
to get the
It's-
vaccine. This is
correct.
just us saying,
We just
thank
highly
you to all our
encourage-
staff members that have gone to protect our kids and the rest of the staff.
Yes, Mr. Gonzalez.
Thank you.
Question, this stipend would be paid in December or when?
Oh, Mr. Sanchez.
After the window, right?
Good
Or
question, Coach.
Month by month, or, I don't know.
No, well, it'll probably be sometime, all the days are tough now, probably November.
Okay.
Because December is gonna be a hectic month, because that's when we pay partial stipends to
Stipends.
some of
Okay.
the staff that gets semi-annual. So November or December, I'll give you a better time later now.
Okay, that way staff will ask and at least
After
they
the
know.
cutoff date.
Yes,
Once the
correct.
window closes,
Our staff submits, right.
Yeah, I know when they were discussing it last time, I think that's what they said after the cutoff date, that we give everybody a chance, those that got waivers and whatnot.
Correct.
Okay.
Okay.
they'll get it in time for the holidays.
So maybe we can target the November.
Yeah.
That
won't
would
be-
be, I think, a good time for them.
Yes.
Yeah.
Okay,
Thank you, Andres.
thank you.
Thank you, sir.
We'll go ahead and take it for a vote. Mr. Nieto,
Aye.
Mrs. Daita,
Aye.
Mr. Trevino. Aye. Mr. De Los Santos,
Aye.
and Mr. Gonzalez.
Aye.
Move on to item H, discussion and possible action for the board to consider approval of the 6th invoice from Weaver and Tidwell LLP for work done in August 2021 on the forensic audit of the district. Dr. Valdez?
Yes, administration recommends for you to consider the approval of the payment of the 6th invoice. This is for forensic work done in the month of August.
Motion to approve.
Second.
Got a motion by Mr. De Los Santos, second by Mr. Trevino?
Correct.
Me. Oh.
I think he beat you to it. So we've got a motion to approve the 6th invoice from Weaver and Tidwell LLP for work done in August 2021 on the forensic audit of the district. Motion was by Mr. De Los Santos, second by Mr. Trevino. Any discussion?
One question, what was the total amount that we paid Weaver for the 6? What was the total?
The total amount so far,
Yes,
It's about 350,000,
how much?
about 350,000.
Okay.
We only have one more.
And we're expecting just one more, right, more, okay.
Okay.
Thank you. We'll go ahead and take it to a vote. Mr. Nieto?
Aye.
Mrs. Daita?
She is
She's off.
muted, I think.
I'm sorry.
There you are.
I wasn't, I had a visitor. What were we doing?
We're voting on the 6th invoice.
Oh,
from
yes,
Weaver.
I heard that. Okay. Yes, aye.
Mr. Trevino? Aye. Mr. De Los Santos?
Aye.
And Mr. Gonzalez?
Aye.
Motion passes. Item I, discussion and possible action to extend the award for ambulance services for the Weslaco ISD 2021-2022 athletic programs, or authorize the administration to solicit proposals for ambulance services, RFP number 20-08-29. Dr. Valdez?
so we're in need of ambulance services for our sub-varsity freshman football games at both Wasco High and Wasco East. Football games for the middle school, varsity soccer for both high schools, and varsity track, varsity wrestling, and powerlifting meets. And so this service was originally approved in August 2020 and awarded to 2 vendors. However, one vendor is no longer in business, so the remaining approved vendor is First Care EMS. And so you have the option of extending the award or to solicit proposals.
I move to extend the award for ambulance services.
Second.
Got a motion by Mr. Nieto and a second by Mr. Gonzalez to extend the award for ambulance services for the Weslaco ISD 2021-2022 athletic programs. Any discussion?
I had a question for Mr. Andres. I know that the last time it didn't process because we had some questions as far as the number of game hours and whatnot. It kind of just didn't add up to what our usual expenditures were and also the usual times.
Yes, sir.
And that was the concern. It had nothing to do with the company or anything like that or the services. I understand the administration wanted to move forward with this because we do have controls. If it's over 50,000, do we have to go out for bids? Is that correct?
Yes, we went out for bid. This is a bid. It's
Yeah,
not a quote.
right, that's what I'm saying. It's a bid that we already had.
Right.
Yeah, so but the issue now is, that's what I'm saying. So I'm supportive of it, but like I said, before it came in at 48,000, now it's 71,000. But we don't have to go to bid because they already had an award. We're just extending it.
Yes, yeah. It will be an option to extend.
To 1 year extension.
One more year, yeah.
And I will
I'm just
say
curious.
this,
Oh, sorry.
Go ahead, Ms.
Sorry,
Jackie.
I'm lagging behind, sorry. Go ahead, I'll ask after.
No, your turn, Jackie. You got the floor, Jackie.
Go ahead, Ms. Jackie.
Okay, sorry, it's because the phone is a little behind, I think. I was just curious, for the varsity games, I see they're not covering varsity. Who's doing the ambulance service for the varsity games?
We'll have,
The city.
The city.
The city.
Oh, okay, so the city of Weslaco is doing it like on their own to help us out?
Yes, Mr. Strata, the city of Weslaco does it free for all varsity football games.
Oh, that's awesome. Thank you to the city of Weslaco.
Yes, thank you to the city for providing that service.
Again, I used, don't know which company, but my son had to be taken from a football game, and in prior years, we didn't have the ambulance service at the middle school games, and so this is really important to me, because they did help my son, had to be taken out in a stretcher, and so I'm glad we still have somebody locally here that is still in business, and obviously based on Mr. Buñuelo's words, and I know Coach Big O would probably say the same thing, that they do provide good service. So again, I'm glad to see this.
My concern is not the service, and I know for athletics purposes, you need an ambulance on site. That's not, my concern is the presentation of the way this was originally presented to us. This was presented to us a month ago or a month and a half ago, correct?
Yes.
And it was presented to us with a different amount that did not require a bid or a quote, yes?
Yes and no.
At the time.
It was a bid. It had nothing to do with not requiring a bid. The amount of games and events that I was given was incorrect, so I presented something that looked low. But it was not to avoid going out for bid because it was already part of a bid. And that's what I mentioned to the board. But you are absolutely correct. The amount was wrong. And then the third page that you have in the agenda is an update that I provided to the board because you all wanted information. I provided it. And here it is, providing for the actual games and a better revision. Coach Banuelos did not get together with my staff in purchasing to get it. We did not coordinate correctly the numbers, and he double-checked his numbers, and it came out to $71,000, the expected games.
Yeah, okay,
of all the
so
games in middle schools.
here's my question on this. It's no longer 48,000, I don't know if that was original, 48,125.
Right.
Now we're at 71,750, and why aren't we going out for bid then if it's at 71,750?
We do have that option. You have that option,
Because
Coach.
we don't have to, because this is already a proposal.
It's
It was a
already
2-year
a-
proposal. Option to go to 2 years.
Do you understand where for me, there's a sense of uneasiness here because of the way it was originally, regardless of the numbers that they had them wrong and this and that. To me, you were given incorrect numbers.
I understand.
in August.
I presented wrong information. You're absolutely right.
So for me, this causes a little bit of uneasiness now because now we're at 71,000, and I know you provided me with or us, I don't know if it was us or me, with several years back. We went back and you looked at.
Yeah, this information.
Okay. So I guess this will be something we tackle next year again, but.
And that's something we can do.
I think so, Coach. We can probably go out next year, and just because our kids are already playing, But
I know, because we went with a month-to-month right now. We have ambulances out there on a month-to-month deal.
Correct.
With them, or
Yes, yes,
event to
yes,
event, but,
Mr. Rodriguez, can I say something real quick?
Yes, sir.
I haven't looked at the contract on this issue, but I think you guys need to look at least one individual in that ambulance is ACLS certified.
There's only one certified individual? I'm
I'm-
sorry, what?
I'm saying, I don't know if there's one individual, but I'm suggesting that one individual be advanced cardiac life support trained.
Okay. So can we make that in the motion to, you know,
Better have that in the ambulance every time an individual at that football game.
Coach, you want to
Just
amend
amend
that
to
so
include
that,
the language.
Okay, amend so we can say what?
they need to be ACLS
Yes.
certified?
Yes, sir.
AC what?
ACLS, Advanced
ACLS.
Cardiac Life Support,
Okay.
trained.
All right, I'll amend my motion to that.
okay,
So do
so,
I. Second.
second, okay, so,
Thank you.
this motion, will be approved pending verification of that
Okay.
certification, correct?
ACLS.
Okay,
And this only protects the district. This is,
okay, so for, thank you, Mr. Spurlock.
Thank you.
So for item I, motion by Mr. Nieto to extend the award pending the verification of the ACLS certification from the company, correct? And it was just
At each game.
at each game. Okay, and that's second by Mr. Gonzalez. We'll go ahead and take it to a vote. Mr. Nieto?
Aye.
Mrs. Taita?
Aye.
Mr. Trevino?
aye.
Mr. De Los Santos?
Aye.
Mr. Gonzalez?
Here, I. Tengo hambre.
Motion passes.
Thank you.
So, thank you, thank you. So we'll go on to item J, discussion and possible action to approve a resolution to designate authorized signers at Texas National Bank. Dr. Valdez?
We need to update the accounts at the district's depository bank with the authorized signers. And it requires a board resolution to authorize those who can sign checks on bank accounts on behalf of the school district. And you have the list of individuals.
So move to approve.
Second.
Have a motion by Mr. Gonzalez, second by Mr. De Los Santos, to approve a resolution to designate authorized signers at Texas National Bank. Any discussion? Take it to a vote. Mr. Nieto?
So, aye.
Mrs. Taita?
Aye.
Mr. Trevino?
Aye.
De Los Santos?
Aye.
Mr. Gonzalez?
Aye.
Motion passes. Item K, discussion and possible action for the board to approve modifications to the Weslaco ISD compensation plan for fiscal year 2021-2022. Dr. Valdez?
Administration conducted an internal TASB study to review specifically the athletic and fine art stipends for specific positions. The evaluation study determined that the stipend amounts evaluated needed to be modified to be commensurate with school districts in the region. The stipend amount increase will attract and retain highly qualified staff to provide high-quality instruction and coaching in the areas of athletics and fine arts. And we do have our athletic director, Coach Rodriguez, and we have our Fine Arts Director, Mr. Christopher Fernandez, and Dr. Sergio Garcia here to present administration's recommendations.
Good evening, Board. What you have, I gave earlier a packet for athletic stipends, proposals, phases, and so possible action on increasing stipends. So on the packet, if you look at athletic stipend proposal, phase one will include athletic trainers, head coaches for all sports at the high school level, and varsity football coordinators, which is your offensive coordinator, defensive coordinator, and special teams coordinator. On the next page, athletic stipend proposal number 2, this is going to be pending our TASB study that we're going to be going out for. This will be football assistants at the varsity level, JV, and freshmen. Middle school, all coaching assignments, middle school campus coordinator, and at the high school, first assistants, JV, freshman assignments. So at phase 1, on the next page, if you can see there on the position, we have athletic trainer as for part of phase 1. And we have 6 stipends at the athletic trainer position. Their current stipend is $14,000. We'd bump them up to $18,000. This would be compatible to the region. These individuals turn on the lights in the morning and turn them off in the evening, work long hours. Based on the study, compared in the valley and the region, we are pretty low in this area, so I recommend that we bump those individuals up 4,000 to 18,000. Varsity head coaches, we have a total of 28 stipends, and these are seasonal coaches, your basketball, baseball, volleyball coaches. Currently, these individuals are making $7,700, and we want to bump them up 2,000 to $9,700. Again, these coaches, if you compare on the stipend study, stipend to stipend, we're even or high, but where districts are surpassing this is in the amount of days. They get us in the days, so 2,000 to be compatible. Again, this is just phase 1 for varsity head coaches. Varsity head coaches year-round, which is our tennis, swimming programs, and golf. We have 8 stipends combined with both high schools. Currently, they're at $9,700, and the proposal is $2,000 to $11,700. Again, similar to what the varsity coaches are where we're at right now with in the region. And our football coordinator positions, which is our OC, DC, and special teams coordinator. We have 12 stipends, and currently we are at $9,700. We propose $2,000, $11,700. That will not make us at the top in the valley or in the region, but they'll bring them up. And again, this is all pending the study that we'll have once concluded with the TASB. So that's phase 1. Turn the page and break down current stipend amount for these stipends. Right now, currently, we're at $493,000. That's what we're currently allocated for these positions. Our proposed increase for year-round head coaches, seasonal head coaches, and football coordinators is $2,000 each. We have total 48 stipends, which brings up to $96,000. And then right beneath, we have our athletic trainers at $4,000, and we have 6 stipends there at $24,000. So our new, if everything gets approved, we're looking at $120,000 added to our allocated budget for this year, which is at 1.4. That's for phase 1. Turn the page. The rationale for this, like Dr. Valdez says, this data was pulled from the TASB report from our area, all 6A and 5A schools, the majority of our schools, districts, to be commensurate with school district athletic programs in the region. We want to attract and retain high-quality coaches that benefit our student athletes. We've had some turnover recently with coordinators that we like to retain our coaches and attract top-notch coaches to our district. The stipend increase athletic is based on the midpoint. This is if we go days embedded. TASB does not recommend days anymore. As more districts are going away from the days because there's a lot of ambiguity there. Daily rates vary. Stipend increases for trainer based on the review of the market, which is our region. The increase in stipend will be comparable with other districts. And currently, we have 46 vacancies open at coaching level, that's gone down because we've filled some up. And then phase 2 will be pending the TASB study. If we look at the next page, which is phase 2, we look at all the rest of the coaches. Football varsity assistant, freshman head coach, currently they're at $5,900. Football freshmen, they're $4,100. This is current right now. All middle school athletic programs, all high school athletic programs that are not football related, and middle school athletic campus coordinators at the campus level, we need to look at their stipend also. At the last page, adjusting all stipends, if we decide to go all out with every single stipend in the district, this is a breakdown. At the high school level, we have 193 stipends, combine all coaches, all vacancies, not vacancies, but coaching positions. The proposed increase for 193 stipends would be $2,000. That's a total, $386,000. At the middle school level, we have a total of 194 stipends. And at $1,200, if we're to increase the middle schools at $1,200, that put the middle schools total at $232,000. Middle school coordinators, we have 4, 1 in each campus. And these coordinators oversee all programs at the middle school year-round. And the proposal for them will be $2,600, total of $10,400. And again, the trainers at $24,000. And if we were to approve that tonight with everybody, our new total will be $653,000, padded on to the $1.4 million that we currently allocated. Our coaches work hard, just like every staff member here in the district. Stipends have not been reviewed or increased for our coaching staff in a long, long time, ever since I was coaching for 17 years. But, these individuals provide a lot of SEL at this time also. It's important. So they play a key part in the education system. And I've always said that any program after school is the best at-risk programs for students. And our coaches deserve something, but I know we're in difficult times right now, so anything would help. So this is my brief presentation for you to consider. Like I said, if we look at stipend to stipend, we're high, but where we become low is the days, when all districts add days, and we just stay with the stipend, right? And I'll entertain any questions.
Thank you. I know we did the fine arts the last time around, and we had, Coach Jesse had some information that we shared with Dr. Valdez, he shared with me. I know we're low, extremely low, and I know you're still waiting on phase 2, but if it's okay with this board, I'd like to give everybody, if that's possible, if that's if that's what everybody's thinking, again, we can all agree or disagree. But I hate to leave out our middle school coaches and all those other coaches and all the other sports at the high school level, because they're already coaching, they're already working, and so we do for one, let's do for everybody. So that's just my take on it.
Being a former coach, and of course, former coaches here, I think it's very important that the varsity head coaches, they take care not only of their program, but other programs all the way to middle school. And I think they should at least get the same amount that the football coordinators get. Because their head coach, whether it's a head softball coach, head basketball coach, head soccer coach, they oversee all the programs, not only their program, versus a football coordinator, just offensive coordinator, defensive coordinator, on the football season, and of course off-season too, but they already get an off-season stipend, or somebody gets an off-season stipend to work that off-season. That's just my 2 cents there.
I think for me, and everybody's going to agree here, we have two successful, or not just two, we have 2 successful schools, Weslaco High, and all the programs are either competing or are competing at the highest level. Year in and year out, playoffs and so forth. For my concern is to leave the assistants for phase 2 when they're the workhorses. The head coaches, the coordinators, they wouldn't be able to do anything without your high school assistants, without your middle school input with their input with their athletes. So, I know it's going to be costly, but I think this is something that hasn't been visited in several years.
That's about 2014, Coach, is when I asked for it.
Well overdue.
Long overdue.
And this does not put us at the top either.
No, it doesn't, Coach.
And I know for a lot of our positions or whatever, we're at the top tier. This just puts us at a competitive level. But I know in athletics, we're competing at the top level. So I think this will be something that we could do now, and then, hopefully in another year or 2, continue to build on this. And I know Fine Arts got a big push already, and that's already been approved, I believe, too.
Right.
Yes.
So, I think it just helps bring all our extracurricular activities that we have that we offer in this district up to par right now, because we've been dragging those guys along, and I think it's time to make that push, and Andres find some additional funds there. So
I agree with you, Coach. I agree with you completely. If you can look at the last page on the packet, and there's a breakdown. If we decide to go all high schools, that's going to be the cost. If we decide to go all middle schools, that's the cost. If we decide to go everybody, that's the cost. So I agree with all of you guys. Most of you guys on the board have been coaches. I was a coach, so I know the work that's put into the long hours in summer, Christmas time, Thanksgiving, spring break, weather days, all those. The coaches are in there.
Oh, the time they sacrifice is endless. I mean, there's no doubt about it. I think we were able to give teachers a substantial amount of increases, an increase plus a those ESSER funds that we were able to do. So I think this right here will really help bring our programs along, financially.
Well, I'm not the money guy, so.
Mr. Sanchez,
Yeah.
are we able to afford it?
And Coach Trevino
And-
brought up some good points that all programs have been successful. So
I agree.
Over a number of years.
I
So-
agree.
Andres, I think you should just find it, and whenever we make the motion, kind of like Mr. Nieto said, our two campus coordinators do a lot, oversee a lot, and to leave them out would be, wouldn't be right, I don't think. But I think both gentlemen would say, take care of everybody else. That's how good of men we got in our district. And so however y'all propose it, but I agree with, again, I said it, I think everybody needs to get it and not wait. But I appreciate the work you're gonna do.
Mr. Sanchez.
He's ready to talk.
Let's see. Gonzalez to finish.
Oh, are we able to find it?
When I discussed the stipends information earlier, we talked about, it was about 100 and some thousand. I said, yeah, that we can do well, because we have some money budgeted for teachers.
Right.
That when we hire, that teachers that retire, we're making more money than the one we hire. So there's some money available, not necessarily 600, because we've been using some of that money already. The thing is, when we increase all this, we have to repeat it next year, plus pay raises next year. And our ADA, as you all know, is low. The enrollment's only 15. I budgeted 15,200 ADA, which is about 95% of the future enrollment. And we're not there yet. So if our enrollment improves, sure, we have the money to pay it.
What is the enrollment right
But
now?
if it
You said?
doesn't-
I couldn't hear you with the math.
15,000.
15,000?
15,192.
192.
And so like when you had 16,500, you were hitting an ADA of 15,000 and change, no?
200.
15,200. So what are you expecting now? Like with the 15,192, are we gonna be at 14,192?
14.8, I don't know. 14.9, it depends on.
We're at
This is just, we're not
14.9
even at
right
3
now.
weeks.
14, so 14.9 and we budgeted at 15.2,
We're at
right?
15.2, right?
So we're off 600
So we're
kids,
off.
Yeah,
about 700, yeah,
7,100 for ADA.
okay. And what is that in dollars?
4 million.
Well, for 100 ADA is 710,000.
No, but I said with the gap, with your predicted gap.
I don't know. Right now, we only have 3 or 4 weeks. We're barely getting started.
Yeah, so yeah,
And
so we're
this is for the
expecting
year,
more,
so-
yes, more kids, more.
We might be able to do it. And I know, I've been told before, yeah, you always say we don't have money, then at the end you have enough money. Right now, we're just getting started and the enrollment doesn't look good. The ADA, I don't know. I don't want to tell you, yes, it's easy, we can get it.
And I understand
What do we
being
do, but what do we do?
conservative. I totally understand, but also with the statements that the vaccine for our younger generation from 6 to 11 might be rolling out next week or the following week after that. Maybe that might encourage some of our parents to know, hey, they're getting the vaccine, so
Send them.
it only helps us with trying to get more kids back to school.
Our enrollment and our attendance.
Yes, sir.
So that is
Well, I'll make a motion.
my 2 million on that, not my two pennies.
If Andres can find the money, I'll make the motion.
I second.
To approve Phase 1 and Phase 2, and to include the 2 campus coordinators, along with that stipend increase of the coordinators you have proposed.
Phase 1, Phase 2, that still excludes the middle schools.
For all,
Yes, that includes
inclusive
everybody.
of all.
Or you want to include everybody? We can
Yes,
do
sir.
everybody, okay.
Phase
And
one
to
and phase two.
include the 2 head coaches with the football coordinator jump. The 2
Yeah,
campus.
they're in there, right?
Yeah,
They're in there?
Yeah,
Okay,
if it's,
just making sure.
if it's the last page, yeah, they're all included in that.
Okay, thank you, Freddie. No need. So that's my motion.
I second.
I've got a,
That's only
but
partial, we need fine
that's only
arts.
part, got fine arts.
Yeah. Well, see,
Yeah.
well, that's what I'm saying.
So we gonna do separate motions or?
We still need the fine arts portion too.
I thought we had already
And then we
approved.
gotta look at that total, because if you do for one, you gotta do it for the other, and then we need to bring Andres back. I mean,
Yes.
we gotta be responsible here too. I mean, I'm gonna go ahead and call it like it is. We need to be responsible. We're in a COVID-19 situation. We're low on enrollment. I'll go ahead and take the hit on it. I said, we're low on, I mean, it's what it is. I mean, I do believe in athletics a lot. I played my whole entire life. And I believe in stipends as well too, and I know the amount of hours that they put. Well, what's more crucial is jobs. Because if we get ourselves in a situation where next year we can't meet payroll and we don't have the enrollment and we hit the ADA and we got losses, we might, people's jobs might be on the line. And I know this because I pay real close attention to the budget, and that could easily switch and change. Yeah, you can buy yourself some time, but you can only go to the general fund for so much. So I've heard your proposal, and I think it's great. It's very well prepared, and I'm all for it. But I think we still need to hear his, because then if we don't hear his and then add the numbers together, and then let's hear Andres again, and ensuring that everybody has a job the following year. Okay?
And those are very good points. Good evening, Dr. Valdez, Dr. Rodriguez, members of the board. I'm not sure, I think you have the slide presentation for the fine arts.
Yes.
And I'll go ahead and turn it over to Christopher Fernandez, the fine arts director. I'm just going to go ahead and go through the first slide just to thank you and let you know that the fine arts staff extends their appreciation. On the first slide, you will see that it is on August 25th, that's when you approved the increases in the stipends. And then, of course, Ms. Ustaita, I think, Ms. Ustaita, if you're still there, she did make a suggestion that we go back and look at specific areas or disciplines that she felt that were a little low. So we went ahead and did that. I want to thank Mr. Fernandez and our two band directors at each one of our high schools, who are also the representatives, the fine arts representatives for each of the campuses, because we've been working on analyzing the information so that we could come back and present it to you. So again, I'm going to go ahead and turn it over to Mr. Fernandez, who will continue with the presentation. Thank you.
Thank you, Dr. Garcia. Good evening, Dr. Rodriguez, Dr. Valdez, esteemed members of the board, our stakeholders and community members. I want to reiterate what Dr. Garcia said about how pleased our staff is, the morale boosted up. Hopefully we will be seeing a lot of those exciting actions take place in their work and the productivity that are coming out of our students. What we're presenting here is focusing on 4 very specific positions. Mr. Trevino, I believe you also brought some of those to our attention. Those are the dance, the drill team, the color guard, as well as our high school one-act play. These 4 positions were low on the stipend end, and so the original proposal was to present extra days. However, as Mr. Rodriguez astutely observed, the extra days are something that TASB is encouraging us to stay away from. So we're going to go ahead and follow that recommendation, and if you turn to the last page of our proposal, what we've done is we've placed the recommended days side by side with what we believe is a fair proposal. In totality, what it's going to add to the number that athletics is presenting is a little close to $11,000 additional dollars, because again, we're only focusing on those 4 disciplines. We're going to table our other positions. We recognize that the stipend increase is substantial, and again, as I mentioned earlier, our fine arts teachers are thrilled to be in this situation, but we want to make sure that it is equitable. So the number in blue is what we're recommending for our head directors. You can see that our high school theater and dance instructors are increasing to $7,000, and then we're calling for our drill team and color guard to be increased to $5,200. We also included our middle school theater, which is at $3,000, and if you go down the line from the current stipends to the amendments that we're recommending, it's pretty equitable across the board. The only reason why drill and color are slightly lower is because they're not UIL sanctioned. However, they are auxiliary and they do operate underneath the same guidelines in terms of no pass, no play. They are auxiliary, and sometimes the sponsors or coaches aren't certified necessarily in these disciplines. So because of that, in our current situation, this is the proposal that we're putting before you that has been taken with the same idea of using extra days to increase the stipend, but have converted it through using TASB's mid-range projection, and then multiplying that by the amount of days that are recommended.
So it's an additional $11,000.
Correct, in totality.
In totality.
Yes, ma'am.
Andres?
Sanchez? Give us a thumbs up.
11,000.
That one we can do.
Now we can do it. Okay.
That one we can do.
The total would be 600 and,
That's another story.
I told it here, $664,000, $664,200 total. If it's inclusive of all athletic stipends plus the
fine arts.
recommended fine arts.
Now, Dr. Valdez,
Do I
you know,
need
I'd like to recommend, you know, we've talked about fine arts and athletics, and, you know, I mean, while we're at it, I mean, we need to make sure that any other stipend that's out there that hasn't been discussed, you know, it should be brought to the table. That's only fair. It's only fair.
Yes, and
that,
we are contracting TASB to do a salary study, a compensation study, and a stipend review.
Right.
But that'll take several months to conclude.
So if your stipend hasn't been mentioned, it will be.
It will be, right.
Dr. Jaime, let me rescind my motion to include Phase 1, Phase 2, and our fine art stipends.
Thank you. Thank you.
Okay. And got a second by, was it Mr. Coach, or
no, Trevino.
Mr. Trevino?
Coach Trevino.
So we got a motion for item K, for the board to approve the modifications to the Weslaco ISD compensation plan for fiscal year 2021-2022 as presented. Motion was by Mr. Gonzalez, second by Mr. Trevino. Let's take it to a vote. Mr. Nieto?
Aye.
Mrs. Taita?
Aye.
Mr. Trevino? Aye. Mr. De Los Santos?
Aye.
And Mr. Gonzalez?
Aye.
Motion passes. Thank you. We'll move on to item 12, closed meeting to discuss A, personnel matters, Texas Government Code 551.074. Item A1, employment of personnel, certified professional and non-contractual personnel. Item 2, resignations and retirements. 3, deliberation regarding the appointment, employment, evaluation, reassignment, duties, discipline, or dismissal of a public officer or employee, Texas Government Code 551.074 and 551.071. A, superintendent's recommendation for the position of principal at Dr. Armando Cuellar Middle School. B, superintendent's recommendation for the position of directors for human resources. 12B, deliberation regarding acquisition of real property, Texas Government Code 551.072. And item 12C, consultation with attorney regarding A, pending or contemplated litigation, B, a settlement offer, or C, a matter in which the duty of the attorney to the Weslaco ISD under the Texas disciplinary rules of professional conduct of the State Bar of Texas clearly conflicts with Chapter 551 of the Texas Government Code 551.071. And it is now 8:26, and we will go into closed session. Item 13. And we reconvene in open meeting. A, possible action if necessary on items discussed in closed meeting. Item 1, discussion and possible action on new employment, certified professional and non-contractual personnel.
Move to approve.
Second.
Got a motion by Mr. Gonzalez, second by Mr. De Los Santos.
He is going for a perfect 10. Beautiful, aggressive front side power downs. There's the
Oh, somebody else. George Lopez.
George Lopez.
George Lopez.
We'll go ahead and take it to a vote. Mr. Nieto?
Aye.
Mr. Ustaita?
She's saying yes.
Mr. Trevino?
Aye.
Mr. De Los Santos?
Aye.
Mr. Gonzalez?
Aye.
Motion passes. Item 2, discussion, possible action on resignations and retirements.
Move to approve.
Second.
Motion by Mr. Gonzalez, second by Mr. De Los Santos. And we'll take it to a vote. Mr. Nieto?
Aye.
Ms. Staita?
Aye.
Mr. Trevino?
Aye.
Mr. De Los Santos?
Aye.
Mr. Gonzalez?
Aye.
Item 3, discussion and possible action on superintendent's recommendation for the position of principal at Dr. Armando Cuellar Middle School. Dr. Valdez?
Recommendation is for Graciela Palacios to be our principal at Dr. Armando Cuellar Middle School.
Motion to approve.
Second.
I got a motion by Mr. De Los Santos, second by Mr. Trevino.
Yes.
Go ahead.
And we do have Ms. Palacios here.
Take it to a vote. Take it to a vote.
Congratulations.
Congratulations.
One more, quick, we need to take it to a vote first.
Oh, that's right. I false started
We'll
again.
take it to a vote. Mr. Nieto?
Aye.
Mrs. Ustaita?
Aye.
Mr. Trevino?
Aye.
Mr. De Los Santos?
Aye.
Mr. Gonzalez?
Aye.
Motion passes.
Congratulations.
Congratulations. Item 4, discussion and possible action on superintendent's recommendation for the position of directors for human resources. Dr. Valdez?
Recommendation is for Daniel Buttimer and Doralisa Zavala
So
to
moved
be
to
our
approve.
directors for human resources.
So
Second.
move.
I've got a motion by Mr. Gonzalez and a second by Mr. De Los Santos. We'll go ahead and take it to a vote. Mr. Nieto?
Aye.
Mrs. Ustaita?
Aye.
Mr. Trevino?
Aye.
Mr. De Los Santos?
Aye.
Mr. Gonzalez?
Aye.
Motion passes. Congratulations. And number 5 is a no action item, is that correct?
Correct.
Correct. And then last 14, adjournment.
So moved.
It's 9:53.